YouTube as well, being live streamed. YouTube as well. So this is now being live streamed on YouTube. Okay, cool. So yeah, Gareth, first of all, thank you so much for being here today. It really means a lot. Thank you.
Not a problem. I wouldn't miss it.
So yes, we had about 98 registration. So
Great.
I'll be expecting about maybe 40 people turning up.
Okay, great.
But this is being recorded anyway. Because I have
Excellent.
a delegate from India and America wanted to join, but because of the time difference and time of commitment, they couldn't. But yeah.
No problem.
So now we've got about 11 participants. That's okay. That's good. And we also have Sion Brand. Good evening, Sion. And I believe, hi. But yes, I'm very excited about today because this is the second edition. And as well as we kind of having Katie Connolly from the Social Prescribing Charity to talk about her work with pharmacists.
Yeah, fantastic. I'll try and make it as relevant to pharmacy as possible. Like this is key aspect of what we need to do.
Definitely. I mean, I guess it's still. Oh, hello, Isabel. How are you?
Hi, Isabel.
Hello. You can hear me?
Yes, we
Yes.
can hear you perfect. Thank you
We
so
can
much.
see like Geneva in the background.
Yes. It is Geneva, but with the sunset.
Yes,
Nice.
lovely. Fantastic.
It's not too much. I can change, but
No, it looks great. It looks great.
So you probably make a start in about 1 minute because I
Sure.
remember last year we went overtime by like half an hour.
Yeah, no problem. No, I'll keep it nice and short. Like I'll keep 15 minutes, like you said, and then 5 minutes questions, and then that's it from me.
What I'm really excited about for today is we have lots of pharmacy students, and when I was going through the registration, and I strongly believe that pharmacy students are the future of the profession and social
Definitely.
prescribing.
Absolutely. I totally agree with you. I mean, there's such an opportunity as well for them.
Definitely. So yes, Garrett, is now 7 o'clock.
Yep.
Probably can start now.
Happy to start. Yes, absolutely. If you give me permission to share my screen, I'll share.
Oh yeah, of course. Yeah. I think you should be able to, no?
Not at the moment. It says host disabled. Participants share screen.
I've just shared my.
There you go. Perfect. I'm ready to go. Okay. This is it. Is that it?
Yeah, you can.
Okay, great. Thanks very much. So Aaron, thank you very much for inviting me to speak today. It's been a true pleasure, and delighted my colleague Isabel can join us from Geneva. So, and for those who are tuned in, I hope you enjoy the next 2 hours of inspiring lectures from those colleagues around the world, and hopefully we can work together to implement Sustainable Development Goal by 2030, particularly SDG 3. So let's get started. And just a little bit of background about myself, and what I thought I'd speak about was global health advocacy and championing the Sustainable Development Goals. So my name is Gareth Presh, founder of the World Health Innovation Summit, and I'm also the expert lead on SDG 3, which is with the UNGSII Foundation, which has been tasked to implement the 17 SDGs in cities around the world. And I'm the founder of the Global Social Prescribing Alliance. I'm a visiting lecturer at Fujitsu, the Knowledge Management Institute in Tokyo. I'm also a member of Pope Francis's COVID Vatican Commission with Group 2, Looking to the Future. And my talk is going to be really about the future of healthcare and where we go with Sustainable Development Goal 3. And just a little bit of context in terms of my background and how I've come into this area. So I was the former Chief Officer of the National Haemophilia Council in Ireland, and I worked across the spectrum of healthcare from property services to variant CJD to, shall we say, procurement of factor concentrate and health promotion, different areas, acute hospitals. And I'm heavily involved in championing social prescribing as well. So why are we at this situation? And this is a presentation I gave at the European One Health Conference in Romania in 2019. And I thought we'd just start with what's coming in pre-pandemic, shall we say. We face a global shortage of 18 million staff. We are about, the costs are rising, skyrocketing. The population is exploding, up to 10 billion by 2050. And then aging population, which is hitting us quite hard at the moment as well. And then we're ill-equipped for this. And we can see this throughout the pandemic. And I'll go into more context in terms of what we need to do to change that situation. If we look at the definition of health from the WHO, health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. We're used to this sickness factors here of what we treat in terms of the current system. And that's really an area that needs vital support. And that's where the pharmacy side comes in as well. On this side is the right-hand side, which is completely underdeveloped, which is the health side. And that's where we're factoring our SDG 3 work, which is on what is the value that this creates. And we can clearly see from COVID that that's substantial. Health is really the future of a well-being economy and also a knowledge economy as we move forward. But the challenge is, how do you move the dial and how do you demonstrate that evidence? And that's what we've been working very hard to do through the Global Social Prescribing Alliance, gathering the evidence, and with our partners also around the world to implement and also bring the finance to these projects. So giving you an insight into what we've done in the UK and how we prototyped this, this was our World Health Innovation Summit in Nottingham. And what I want you to look at that picture and see is that that's actually your GP practice at scale. That's how we influence population health on a wider context. But also it's bringing value to the local community and also the city. Because if you bring 5,000 people into an economy, into a city, they actually spend money. And at the same time, you're increasing the population health and well-being by providing them with the information around good health and well-being. So what WIS is a preventative healthcare platform that empowers people to improve their health and well-being by facilitating that community engagement. And we've evidence-based this as well. So my background, having worked in haemophilia care in Ireland, I just basically inverted that model into the community and then evidenced it. And the return on investment was £1 invested, 36 back. And so that's all published. It's out there. It's on our website. This is the future in terms of how we move forward with the SDGs. And that's really about collaboration and working together. So it's me and you, we, others, us, and how we move that forward. And that's very much the context of the Sustainable Development Goals. How does that link into social prescribing? So about 2 years ago, I had been meeting with James Sanderson at NHS England, and we've been discussing social prescribing. And when an opportunity came up, I said, James, we're working on the SDGs. We're doing this across cities. Why don't we establish the Global Social Prescribing Alliance? And then with Isabel, who's joined us here from Geneva, from the WHO, we brought this group together, and we've started to implement this, shall we say, the social prescribing practices around the world. So we've created a playbook, also a student framework, which is free to download. If you go to the Global Social Prescribing Alliance website, you can download those tools. And then what we're doing is we're actually bringing this forward to the SDGs and implementing it within the cities program. So the Global Alliance has 5 core streams. I just thought I'd touch on this: international community of practice, implementation of champions, research and academia, workforce development and policy. So what we're trying to do as well is create that evidence base so that we can bring also investments to this space. So now touching on the SDGs and particularly the SDG cities. In 2018, I presented the work of the World Health Innovation Summit that I talked about in the past in Geneva, and I demonstrated the process that we went through. And in the audience was the UN Director General Senior Advisor, Roland Schatz, and he worked with Michael Muller, and he asked me to join the SDGs Cities program. At the time, I didn't really know what it was about. And then, as you can see, in 2015, 193 heads of state stood up and said, this is our roadmap for the future. The foundation was created to accelerate and implement that process. So we have an opportunity through SDG 3 to go across all 17 SDGs. And that's what we're doing in the cities at the moment. In terms of bringing the finance, so this is where it gets really interesting, is how do you bring this value creation through health and well-being, for example, into a fund, or how do you create a mechanism that demonstrates value for money? That's actually quite easy, because I've been doing some work with the World Bank recently, with the Climate Investment Fund, and I've been telling them about, investing in zero emission buses, how you reduce the air pollution, for example, reduce cancer cases, and so on and so forth. This then you can apply into a commitment report in terms of what are the top 500 companies in the world, how are they spending their money, and then how do we actually demonstrate that in value for a city? That's what the index fund is about at the moment, and that's a little bit of insight into what we're doing in terms of actually financing these projects. So just to talk about some of the processes that we're involved in the cities program, and we've created the Kinshasa process, which is with the Democratic Republic of Congo around sustainable mining. And you might say, what's that got to do with health and well-being? It has everything to do with health and well-being, because if the country can't raise taxes through selling its commodities, if it's always been stolen, for example, then how are they going to be able to invest in health and well-being? So we created this Kinshasa process, which is around sustainable mining. And then what we're doing there is helping the DRC with the extraction process and the selling process, and then they can invest in health and well-being, which is SDG 3. So that just brings a full circle, so you can get an understanding of how this all works. The second thing is, how do you scale these? So you need partnerships. You need to be able to work with UN agencies and other agencies around the world that are doing great work. And this is what we do with the Vatican Commission, UN Academic Impact, the African Union, UN Habitat, and various other agencies. And when COVID hit, we were asked to produce a document which is around the corona perspective, and we were able to share that knowledge around the world. So that's how we were able to bring all these parties together using these platforms. A little bit of a context in terms of, should we say, our partnerships and the work we're doing. Isabel is at the forefront of a lot of this work with WHO, and some of the policies that we've written for the G20, for example, last year, myself and James and colleagues had the opportunity to present this work to the Global Solution at the World Policy Forum, and then putting social prescribing at the forefront of what we tend to do at the future of healthcare. This is the Alliance, a bit more about what we're doing, how we're scaling it. At the moment, we've started discussions with Austria, for example, with the Austrian government, and we intend to meet them in June. So all of these things you can bring forward, and all of them have a business model behind them as well, which is really important that you're able to demonstrate the value created. This is the World Urban Forum, which takes place in June. And again, Global Social Prescribing Alliance is one of the solutions that we're putting forward to the mayors when we meet with them. Why are we doing this? And it's important to kind of end on this sort of slide, should we say, because it's really important to understand the pressures we're under at the moment. So everyone will be familiar of the, at the moment in, the escalating the elective surgeries, 28 million globally, the waiting list. We've lost so many colleagues as well over the last 2 years during the pandemic, the brain drain, increases in dementia. So we need to look at ways and means that we can offset these costs and also improve people's health and well-being, because remember, we've got a rising population. We also have demand is increasing. We're also in crisis management all the time, burnout. So how do we actually support the health service and create a circular economy? Because there is a supply chain already existing, and we can actually anchor our services into that to create new wealth. So that's very much what we're trying to do at the moment. I just wanted to, I won't play this video, but you can check it out online. This was just from the recent Congress we were in Ankara around climate change. And I thought I would finish on that because the link between climate and health is intrinsically linked. And we very much have to look at how do we bridge that gap and how do we raise that awareness, because that's the future crisis for healthcare at the moment. And it's very much, I hope, at the forefront of the SDGs. So I'll stop that share now, and I'll take any questions that you may have.
Thank you, Garrett, for this very powerful presentation. For the delegate that's been watching this, I just want to emphasize that as pharmacy student and pharmacists, we tend to be quite narrowed in one thing only. And what I love about Garrett's work is that it really enables you to think at a broader scale, and his presentation really kind of demonstrated that. So for anyone that's here tonight, if you got any question related to his work or in general, please free to put it in the chat, and I'll be monitoring it now. Especially if you're a pharmacy student, this is your time to get high-level answers.
Yes, absolutely. Please, any questions? Happy to answer. I mean, my question to the pharmacists is, are you aware of the 17 SDGs? Because that's, the key aspect. That's our global, like, where would you get, if you look at what we currently experience on the political scale, we've managed to actually get 193 heads of state to agree on 17 goals and 169 targets. So, I mean, that's quite an achievement. So I think it's up to us to make sure that we hold our politicians accountable, so it's a massive opportunity, and particularly the pressure that the health service is under at the moment. It can be a real driver of positive change. And it's important to emphasize as well, the work that I'm engaged in, and Isabel will say, when we're at these conferences with UN Habitat and other institutions, there is no shortage of finance. The problem is projects, actually. You might find it's hard to believe, but actually investing in cities is actually quite a profitable business. And what they lack is actually, how do you bank projects? So it's the bankable. It's actually bringing the institutions to the city mayors so that they can actually work together to actually bank projects. That's where the real challenge comes from. And so once you understand that supply chain, we can actually find solutions. So that's what we're trying to do at the moment. I mean, just before this presentation, I had a call with colleagues and investors in San Francisco, for example. So that's what we're trying to do, to create funding mechanisms for these projects, because there's a lot of great projects out there, but they just can't get the funding.
Definitely. I think one of the key common topic that came about when I was doing presentation on pharmacy social prescribing during UK University roadshows, I was actually talking about your Gareth, about the GSPA, about the WIS. And then another thing, a term that came up with, actually, we do have a question. Isa. Okay, so Isa, there's no stupid question at all. This is a protected space, because every single person here tonight is part of a change. And I see every single one of you to be a leader of this profession out of the social prescribing history. So in a nutshell, to answer your question, social prescribing, the way I see it, is a personalized care plan to fully realize the potential of a patient, which can be financial support, housing advice. And Garrett's presentation was basically more at the macro level, at the bigger picture, not just at the individual level, but like country specific, which might be a lot to take in. But once you get the grasp of it, it's a very powerful concept, and it's going to really equip you with the right set of skill to become leader in this field as a pharmacist when you do graduate and reach as a pharmacist. And from Mathieu, what has been the most interesting project you have worked with so far? So here's the question.
Yeah, I mean, there's a lot of interesting projects. I mean, they're all fascinating projects. But I think the most important things are when you make a difference. So I always go back to, even when I worked in haemophilia, the small things, the small changes that you make that impact patient care, for example, which may be very surprising for a lot of people, but we were enabling people access their medical records and their digital records 10 years ago on mobile phones for haemophilia patients. And that had a massive impact on terms of mortality rates when they turned up at A&E. They were some of the great projects that I was involved in. Just small things like that make such a difference. These big projects that I'm talking about with the SDGs, and although they sound quite granular, they're actually the same. Like, you just apply the same mechanism, only at a bigger scale, and it's really about making people's lives, meaningful, and also, improving quality of life for those who are, probably severely disadvantaged.
Thank you, Gareth. And I just want to say also hi, Dr. Avimera, will be our next keynote speakers. Some of the things that might be of interest to pharmacy students specifically, on the same line of thinking that you have potentially social prescribing pharmacists, I was also talking about I believe SDG 11 for urban planning, on having a potential role for urban planning pharmacists, whereby we could leverage our knowledge in health and well-being and help contribute to the infrastructure of city planning, especially when there's more funding being funneled in cities.
I think from a pharmacist's perspective, if you look at the climate situation, you know, so the pumps even from dispensing, you know, asthma, you know, things, these are really important, and also how you dispense drugs, so important. I mean, I've been speaking about One Health in the past in terms of, you know, a lot of drugs are flushed down the toilet, unfortunately, when they go out of date, and what happens is they end up in our food chain. So, you know, they're dispensed into rivers, and it ends up in fish, and these are sort of things that a pharmacist can actually impact on. So being aware of that situation and what that means for our public health, from an AMR perspective, you know, these sort of things are really important from a pharmacist perspective, and also from a financial point of view. And one of the things we're working on with Isabel and WHO and other agencies is our pension funds. So what is our pension funds used for? Where does that money go? These are questions I never asked. So when I was a public health servant in the Irish Public Health Service, I didn't even understand where my pension fund was spent. And this is critical to ask the question, where is my money being spent? And I mentioned the SCR 500. That's where we analyze the top 500 companies in the world, and we can tell you, we read all their annual reports and we find out what is it that they're actually spending their money on, and what are they going to spend their money on. And everyone has to be aligned to the SDGs. And even the likes of Microsoft, we haven't quite got Facebook yet, but they're now starting to disclose. When we started it in 2017, it was about 70%, and now it's up to about 93% of the top 500 companies in the world actually disclosing something around the SDGs. This then drives the investments. Do you see what I mean? So these are important for pharmacists to understand that.
Thank you, Gareth. I think we have a comment from an anonymous attendee saying he work in health tech. I believe, I think may have been a typo.
Yeah.
Encourage other pharmacists to consider practice. He asked, do you have any tips to empower others to do this, as in to incorporate health tech?
Health tech. Yeah, well, again, when I previous experience working in e-health in the NHS and other areas, it's so important to understand that doctors and our health professionals want time to treat. And it's also important to understand the benefits of technology as an enabler for, you know, so one of the things is that, you know, making the business case towards, well, you know, this will give you more time to treat more patients, which is what the clinician wants. And at the same time, it gathers the data that we need in terms to make the business case so that more funding can be released. That's the way to enable, you know, technology to be adopted. A lot of the tech companies don't understand how to do that, so they just send project managers in, and it causes a lot of problems. So these are some of the tips that I would advocate.
Thank you so much, Gareth, for your evergreen quotes from 2017 till now. And so it is for me a nice segue for our second speaker, which is Dr. Avi Mehra from IBM. So basically, I've kind of met his work through the CEP program, Clinical Entrepreneur Program, where I also attended a webinar, and I'm just blown away by the level of expertise he was able to open up. And I'm just so happy, grateful for your presence, Dr. Avi, and thank you, Gareth. So what I'm going to do, Dr. Avi, I'm going to make you a host.
Great, thanks, Aaron.
I'm just trying to
and thank you. Great to meet you, Gareth. Enjoyed the last bit of that presentation. So
pleasure.
I think Gary, really, do I have to do it from? Would you be able to make Avi, Dr. Mehra, a host maybe, so he can share a screen? I think.
Yeah,
that's what I'm giving you the ownership.
Oh, got it.
Awesome. Thank you so much, Gareth.
Right. And Aaron, can you see my screen?
Yes, I can see your screen.
Okay, great. So firstly, big thank you to you, Aaron, and the whole team who've put this on together. Really grateful for the invitation. Thanks for inviting me, and looking forward to this short presentation and some questions afterwards. And look, if we can't get through all the questions today, feel free to reach out afterwards as well. So my talk, just for the next 15 minutes, is going to be around transforming social prescribing through digital technologies. I'll be honest, when Aaron reached out to me asking me to give a talk, I was unsure about what I should present on. So I'm going to be providing a bit of an overview to think more out of the box in terms of what are some of the next generation technologies that you can think about when we're thinking about innovating in the space. outline some of the challenges we're facing from a health and social care perspective, but also challenges from a technology perspective when we're looking at innovating in this area. And if I have time, I'll share a few tips for the budding innovators and entrepreneurs in the room. So firstly, quickly about myself, I'm a doctor by background, clinical background, mainly in general medicine before moving into industry. I spent the last 5.5 years at IBM trying to get health tech to work properly, which is very challenging. So I'm currently an associate partner for healthcare and life sciences and clinical safety officer at IBM. And I'm also the co-founder of Doctorpreneurs, which is a partner for the NHS Clinical Entrepreneur Program, essentially a global community for medical innovators and entrepreneurs. And I also do a bit of digital health advisory work as well. So let's jump in. So in terms of scene setting, I just wanted to sort of frame it in terms of, what are some of the key challenges the health and social care system is facing? And these are some of the big ones that I've identified. And as we're going through the presentation, use this as inspiration for areas that you may want to be thinking about innovating in. So as we know, the pandemic has accelerated and exacerbated the demand for care and health and care systems. And there's a huge amount of pressure on the system right now, both health and social care. We're seeing a rising cost of care coupled with ongoing financial constraints, which means clinicians are constantly being asked to do more with less. As we know, and we'll probably hear throughout this conference, increasing rates of mental health and well-being issues, and increasing rates of issues like loneliness and isolation. We're also seeing many more individuals with complex social needs, and to add to that, also complex medical pictures. So an increasing burden of chronic disease and multimorbidity, when coupled with that complex social needs, really presents quite a complex, difficult challenge. And then to add to that, obviously, as we see today, a huge cost of living crisis, ongoing personal financial challenges, and rates of unemployment as well, which are very difficult. So when you put that together, a very difficult and challenging picture and a lot of different issues at play. And so I think we can all agree with this, that really social prescribing as an area, and I know it's something that's really come to the forefront in recent years as well, but has an absolutely key role to play in tackling many of these challenges. And more so, digital technologies can have that transformative impact on social prescribing. And as Gareth said, act as that enabler to help accelerate progress towards truly universal personalized care across the whole health and care system. And so in terms of, again, framing it in terms of some of the digital trends to be wary of as we're thinking about innovating in the space. So we talked about some of the challenges at a high level, but what's happening to allow innovation and digital technologies to start to flourish in the health and social care system. So a number of trends at play. Firstly, of course, the COVID pandemic has been accelerating digital health adoption, as we've seen, telehealth being a great example. We're also seeing explosive rates of health data growth. It's approximately, I think, a stat I've heard, 30% of the world's data is from the health and care industry. So a huge amount of data being generated, but we don't know what to do with it. Technological innovation, we'll talk about this today, making strides forward and computing power really increasing. As we know, patients and consumers are more engaged and empowered in their care, both from a health and social care perspective, and also expecting much more personalized, highly accessible health and social care experiences. We're also seeing health and care systems pushing forward bold innovation and reform agendas. We talk about integrated care systems in the NHS, and really that desire to bring that holistic picture together, bringing together health and social care with local communities to truly deliver population-based outcomes. We're seeing increasing investment in digital health. So for all those budding innovators and entrepreneurs, there's no better time to be innovating and launching your startup, whether it's in the health or social prescribing space. And of course, non-traditional entrants are disrupting the markets, the likes of big tech, other non-traditional companies, and of course, startups coming in and innovating where the healthcare system has struggled to so far. And so more specifically, what technologies can be that enabler in amplifying the impact of social prescribing. And here I've just outlined a number that we'll cover on very, very briefly in today's talk, but everything from digital platforms and remote monitoring to artificial intelligence and machine learning, an area that I've been focused on quite heavily in IBM, areas like augmented and virtual reality, and of course the metaverse that we hear so much about, digital therapeutics, blockchain, social media technologies, and all the rest. And really, how can we start to leverage some of these in terms of the way we think about social prescribing as a discipline, the way we can enable different models of care and different services to be delivered. And I think the key message I want to start with is that digital technologies can really help join up clinical and non-clinical pictures and provide that holistic, person-centered approach to improving health and well-being, whether that's for the citizens using the services as consumers, health professionals who are prescribing the services, so the link workers or the GPs or the pharmacists or other healthcare professionals, or the organizations and professionals who are delivering the services. So when we're thinking about technology, thinking about it from all those different perspectives. I think from my perspective, when I read about the space, I think one of the biggest impacts digital technology can have is really to improve access to non-clinical programs and support. And that could be through virtual platforms and marketplaces, which are providing a new way of individuals and patients to engage and find out about new services, through to digital communication and collaboration tools, so a new way of communicating online between patients, or also between patients and pharmacists or the link workers, online databases and communities, a huge amount of new information out there in terms of online communities and areas where previously patients would not have been able to access, and everything else, including digital tools and applications to support with financial planning, jobs, housing, employment. We talked about pension planning, all these things, and we're seeing some really interesting tools and applications out there that can support patients and citizens in their journey. And of course, to some of the more mainstream areas like nutrition and fitness and online education, which we're seeing absolutely explode in the digital space. And so I think, firstly, access is absolutely key, and digital can be that enabler to improve access. But let's go further. And what about the area of digital therapeutics? Now, for those of you who are new to that term, digital therapeutics, really what it means is all the area around evidence-based software, therapeutics and interventions to tackle health, social, and well-being issues. And traditionally, you may see this in the medical side. It could be in areas like a software-based intervention that's targeting a diabetic patient or a patient with cardiac disease and supporting them from a digital perspective on their medical and health journey. But if we think more broadly, this huge application in the social prescribing space, again, we're seeing an increase in the number of applications and digital therapeutics focused on things like smoking cessation, substance abuse, and also other addictions. Organizations like Pear Therapeutics and Quick Genius are ones to check out if you're more interested in the substance misuse, to holistic chronic disease management. So not just the medical side, but also health coaching beyond medical management of disease. Companies like Livongo, Omada doing great work in the space. Digital therapeutics to support individuals with mental health and well-being like Headspace Health and Calm, and of course, digital health and lifestyle coaching. So really have a look at the whole area of what we call digital therapeutics applied to social prescribing. Beyond that, again, facilitating the ability to do that is wearables, remote monitoring, and this concept of virtual wards, which we've seen come up throughout the COVID pandemic, being able to manage patients and get a holistic overview and assessment of not only their medical needs, but also their wider well-being and social care needs through utilizing wearables and remote monitoring technologies, but also through the platforms that allow a medical professional to connect and share information with a local community worker who can also then share information with the pharmacist and really allow healthcare professionals to connect around the patient, providing architecture that collects data which is centered around the patient, so it's linked, it's not siloed. You're seeing a whole picture of medical, social, and other well-being issues, and then being able to deliver it in the patient's home or within the patient's community. So again, wearables, remote monitoring, virtual wards, another area to think about on your journey. And then an area I've been very close to in the last few years is AI and machine learning. And as we know, there's huge potential for artificial intelligence and machine learning to have a tremendous impact in both health and social care situations and broader as well. But the reality is the potential is huge, but we've still got a long way to go to harness the data that's being generated from both medical and social care settings to really generate those actionable insights. But let's have a look at a few examples that can really bring this to life. And one of them that we're seeing quite commonly is the use of AI-powered virtual assistants and chatbots. And now we see this in customer service already, whether you're online accessing a retail experience or other, and you may have a chatbot on screen. But think about it in a community setting or from a social prescribing setting, again, supporting the social prescriber with Q&A or insights or information at their fingertips, so they don't have to go and speak to another colleague or professional. They can simply ask a virtual assistant or chatbot. But more importantly, from a patient and citizen perspective, getting that information at their fingertips, having a virtual assistant to support them and provide those nudges and those advices that can really help them and transform their well-being. And again, this is just an enabler, but can be a critical aspect in terms of helping to provide rapid access to information and helping, again, for individuals to feel more connected where previously they may feel more isolated, and another area to look at. And really, when we're thinking about AI in this context, we're thinking about it to generate insights, to deliver more personalized social interventions, to support with better monitoring and prediction of health and social well-being, to enable and empower better self-care and well-being through those applications and other services, to also improve and automate social care processes and pathways, thinking about, again, the prescriber, the professional, the organization, how AI and machine learning can be used to automate those processes and streamline care, to augment and support the social link worker and professionals with decision-making and thinking about what they need to prescribe and the best services available for that patient, and then really helping to join up the data and join up clinical and non-clinical pictures to really move towards that area of precision social prescribing. And again, this is rapid fire because I know we've only got 15 minutes today, but the next is around the metaverse and using technology like virtual reality or augmented reality to, again, think about how we augment and enhance the experience. I know you've got some excellent talks lined up by other speakers that may be covering this, so I won't go into huge detail. But again, when we're thinking about VR and AR, be thinking about the potential use cases, again, from a citizen perspective, to support them in terms of engaging in a new experience, to access new services through virtual means, through services potentially being delivered and offered in the metaverse. But also thinking about it more broadly. And we're seeing concepts now like non-fungible tokens, NFTs, underpinned by blockchain come in. And this really starts to delve into this idea of these sort of social communities, these social online worlds, which can really tackle areas where citizens are feeling isolated and lonely, and really give them access to services that previously weren't able to be accessed or delivered, but also through a new medium, through that of virtual and augmented reality. Really interesting area to think about, and think about it again on your innovation journey as you're thinking about the citizen and the patient. But really what I want to highlight is, although we've talked about these individual technologies of whether it be digital platforms and telehealth, digital therapeutics, AI and machine learning, AR and VR and so forth, the real transformation occurs at the convergence, where these technologies come together and also where we join up clinical and non-clinical pictures. And we really look at the wider determinants of health together. And that's where we'll see true transformation occurring, again, both from a service provision perspective, but also from a patient experience and consumption perspective. But there are challenges, of course. And as we heard from the last talk, it's not easy. Technology is an enabler, but it is not a silver bullet. And there are many challenges that we need to be wary of on this journey as we're thinking about implementing digital technologies. And that is just a few to go through. Firstly, the complexity of health and social care system and the dynamics involved, incredibly complex and a barrier. The current infrastructure of IT and the lack of interoperability across health and social care settings is a major challenge as well. We talked about data being king, but actually we have huge issues with data access, data quality, and linkability of those clinical and non-clinical data sets. Digital exclusion and digital addiction. We don't want to foster a widening of inequalities through bringing digital in. Evidence, proof of effectiveness and value, of course, is always going to be challenged when we're talking about technology. We need to prove it both from a clinical, but also from a cost-effective and economic perspective to show these interventions are actually providing benefit. I talked about widening health inequalities, and that can be true because if we start to bring technology in different ways that excludes certain groups or widens existing inequalities, that's not going to be good and something we need to think about head on. Awareness, engagement, and adoption. So it's great having these digital platforms, but in reality, we have a huge effort to educate and really inform citizens about the potential in simple layman's terms. Otherwise, really, we'll have many different services or technologies out there, but nobody utilizing the true benefits. Of course, areas like risk aversion, trust issues, and resistance to change are always going to be common when thinking about implementation of technology. And then finally, data security and privacy, massive when we're thinking about our personal health and social and well-being data. And of course, funding and financial challenges that health and social care and local communities are going through. And so again, I just wanted to take you through a very, very high-level view of how digital technologies can be used and thought about to transform social prescribing and really deliver that precision social prescribing. And really, when we're thinking about the future of health and social care, these are some of the key themes that I often like to emphasize that we're hopefully moving towards. A system that is predictive, which is based on predictive analytics, is preventive, moving away from sick care to prevention and wellness and tackling the wider determinants of health. A system that is personalized, taking into account genetic, environmental, and social factors. It's participatory, involving the citizen all the way through their care and their well-being journey. Integrated, we talked about integrated care systems and the bringing together of health, social care, and communities. And then digital, underpinned by digital technologies that are trusted, that can deliver tremendous potential and can really transform the space. And so again, hopefully that gives you a little bit of inspiration when thinking about your entrepreneurial innovative journey in the social prescribing space. Again, feel free to reach out to me after the call for any questions, and I'll hand it back to you, Aaron, for any questions you want to take right now.
Thank you so much, Dr. Avi, for this powerful presentation. I just had a huge smile when I saw the term precision social prescribing, because when I told you about it a few months back, I was just still early stage earlier, but the way you came up with it, that we're going toward it by kind of combining the clinical and non-clinical side, you summed it up perfectly. So we do have a question from Sion, which talks about how do we ensure that the availability and equitability for those experiencing digital poverty. And the second element is, how do we make sure we're not driven by tech and use it more as a facilitator to maintain a personalized care approach?
Yeah, absolutely. Great questions, both of them. So the first one, absolutely raising in one of my challenges, right? In terms of, and I think, how do we do that? We have to involve representative groups of the communities and populations throughout the evolution of when you're thinking about designing, developing, implementing any digital technology or any new solution. So it can't be developed in a vacuum and in a silo and then try to be implemented. We need to think about the whole range of different individuals and their different needs, involve them in the design, involve them in planning, and really make sure that's a representative group so that we don't have widen those issues, as you rightly pointed out. And to your second point, is it more of a facilitator? I completely agree. Think of technology as that enabler. What's really going to be transformative is people at the end of the day. And when you bring together communities underpinned and enabled by technology, that's when you get true transformation. But again, definitely agree with your point. We can't be too tech driven, and we need to use it as an enabler to accelerate and enable new models of care.
Thank you so much, Dr. Avi, Mera. Just one question from Ibrahim. He's asking, will you be able to share the slide maybe afterward? I mean, should people contact you to get the slide, or?
Yeah, that's fine. Just drop me a note and I'm happy to share a PDF version. Absolutely fine.
Okay, sure. And you're about to show the 10 tip or something? I just
if we had time, but I know we don't have time. So I know we didn't have time. That was just in case I had an extra couple of minutes. If you feel we've got 2 minutes, I can quickly go through them.
Yeah, let's do it. I hope Isabel doesn't mind. Go
okay,
for it.
Very quickly, within 1 minute, my top 10 tips. If there's an innovator or an entrepreneur thinking about digital health innovation, these are my top 10 tips. The first one is to take a step back and ask yourself why. Understand why you want to innovate the space, what's motivating you, what's driving you, because that why is absolutely key. Tip 2, and I'm glad everyone's attending this conference today, read broadly and educate yourself about the space. In preparation for this talk, really immerse myself in the social prescribing space, something I haven't done for quite a long time. Tip 3, identify real problems you're passionate about solving. There's going to be a huge range of speakers today. You're going to hear a lot of different areas, a lot of different problems, but think about those that you're really passionate about, that you yourself can't not do it, that you have to do it, because that's what's key when you're thinking about innovation and entrepreneurship, that you're passionate about what you're solving. This goes back to the point around involving users. So understand what the real needs are. Speak to users, speak to patients, speak to citizens, map the journeys and deeply understand the pain points and be obsessed about it. Start small and get a hands-on experience ASAP. You don't need to go away and be thinking big about a huge startup or a huge idea. Just start small with problems you're seeing in the local community, with patients that you might be working with on a day-to-day basis, and iterate and move on and get feedback often. Don't keep your idea to yourself. Share it. If you're thinking about entrepreneurship, start with a small co-founding team and hire very slowly and deal with all the administrative issues later. Don't be put off. You can start small and hire as you don't need to have a technical expert to begin with. There's a lot can be done with no code or other low technical elements. Network. Again, reach out to me after the conference and happy to talk and again, network with others in the space, and building valuable relationships will be absolutely key. Get a mentor or coach who's experienced in the space. I'm sure there are loads of fantastic speakers tonight who might be willing to mentor or coach some of you in your innovation journey as you're thinking about the space and innovating in it. Think also about your personal value proposition. You might have ideas you want to innovate in from it that you're passionate about, but invest in your own self-development more than any other product or innovation. And then finally, get organized, focus, and be consistent, and just focus on that North Star and focus on solving real problems that you're passionate about, and leave the rest to sort itself out. So with that, I'll say thank you. Thank you for the extra few minutes as well. And I'll hand over to the next speaker.
Thank you so much, Dr. Mara. And Rithan said thank you for this very brilliantly useful and brilliant inspirational presentation, which was the same effect I had when I saw you speak a few months back. So thank you, Dr. Mara. And without any further ado, we're going to start with the next keynote speakers being Isabel Washmut from the WHO. So Dr. Mara, would you be able to maybe make Isabel a host from your end? I think because you're now a host, so it's kind of like passing the hosting right.
It's okay.
Oh, okay.
You can see my screen?
Yeah, we can see your screen. Thank you, Abby.
Fantastic. Thank you so much. I am so happy to be with you tonight. It's such a big pleasure. And to have the opportunity, in fact, to put in practice the tips have been so well presented by Dr. Mera, because it is really about that and how you go through these tips to the action, to the reality. And for that, I will start with this introduction about our global movement have been set up and very well explained by Gareth. We work together for now quite long time, and I am so happy to be part of our work together. It's such extraordinary to be able to create what I will call extraordinary consortium of partners. One tip, it was about building relationship and networking, and as well how you will be able to create sustainable relationship and partnership based on trust, and as well not just about taking from each other, but about giving to the people. Donc it is really about this type of network we will talk about, and in this spirit we have been able to set up this extraordinary movement, because we consider life is like a movement, is never static. It's in terms of innovation, I will say the new leadership will be not like we have the occasion to see today, but it will be organic. For example, it is like the similarity with the law of this universe in this way, our biological law. In this way, you have cells, they will start, they will grow, and after some moments they will die, but some other cells will appear. You know what I mean? Donc, all the effective network for me, and specifically from the future, will be totally organic. And the Global Social Prescribing Alliance is an example of this type of spirit for me. And we have been able to build specifically from an incubator I have developed in WHO. I will tell you more about this incubator. It's called Art Impact for Health and Sustainable Development Goals. And it is really, to uptake specifically the two first key strategic, movement from our Global Social Prescribing Alliance. The first, it is how we will be able to create worldwide a new universal narrative, to redefine health and as well well-being, and to rethink about medicine today. And specifically, not just the prescription in terms of medical, prescription, but in terms of social prescription for people in the world. And as it was well said, people need as well psychological support, need some, more big purpose in their life, and that will lead to well-being. Look, it is really what we will see with specifically the bridge between art and science, because without art, we cannot, tap on our extraordinary creativity. Without creativity, you have no life, you have no innovation. And science is just an extraordinary method, to value this creativity. So the both need to be reconciled. You have not art from one side and not science from another side. And as human beings, we need to use our full brain, the left and the right part of the brain. And it is really what we want to demonstrate with this type of incubator. It is how the people are not just, one silo or one lens, of their potential or their capacity. They have the opportunity today to discover their infinite potential inside of themselves and to create some bridge or some relationship have not been done before, And that is very important, because sometimes, in our rigid system, some people will tell you, oh, it is impossible. No, don't do that. Don't try that, But at the end, it is not the truth. You can explore. You are an explorator, and with your creativity, infinite creativity, everything is possible. Donc, it's really a key message from this movement we have initiated with so many partners now over the world. And it is, as I have mentioned to you previously, to create a new inspirational leadership. It's not about leadership, it is the type of leadership. And today it's nonsense not to consider what I will say a total distributed leadership, where every people, on this planet have a big function, a big role, big mission. Every people is important, and we need to create, to develop this global network based on this consideration. Look, it is really these two key elements, I want really focus with the presentation quickly of this incubator I have mentioned to you. The first, it is very briefly to tell you about the purpose, the nature of the project, and to show you the one use case, and as well to try to inspire you to join us. And first, why we need to have the use of art, in science, and specifically to communicate more properly on the importance of sustainable development goals. Because, the pure use of evidence, like we know, with just data, with just graphic or big report, more than maybe 300 pages, cannot be efficient anymore, because why? People have no time sometimes to really read, they want to uptake the key message that will help them, really to move forward more quickly. Donc it is for this reason we need to reconsider the way we are communicating, the big challenge we face today and specifically to inspire humanity and not the opposite, and specifically to maintain this humanity in fear, but how we can find more hope and more common value, universal value between us. So it is really this type of purpose. And art is a perfect way, in fact, to do that, because it's extremely powerful to establish meaningful and inclusive dialogue between every culture, every country, because at the end of the day, everybody on this planet wants to do the same, to be really happy, to enjoy, every time in the life, and to share, because life is about sharing and again, not taking. And if we change our perspective, the way we want to see the life, we will have totally another, I will say, design of this planet, and more sustainable, of course, but as well more in harmony with each other. And it's for this reason we thought art is extremely valuable. Why? Because art is an universal language. Art has no borders and promote diversity in unity. It responds to our needs to share, inspire, and transform. It transcends our perception and sense to reveal our infinite potential and inner well-being. It's really like a resume of what can be the power of art, and specifically how we can communicate. And for that, the mission of this incubator, it is really to support people, to engage people, to contribute, And specifically, we are so happy because we can, with this incubator, interconnect with all the artists over the world. And you have so many artists incredible over the world. And as well, so many initiative leaders, innovate to help really marginalized and very vulnerable population. And in general, they have no voice. They have no voice in the international community. And we thought, for example, art is an extraordinary channel to bring this voice, in the scene of the international community. So we are working at country level, local level, country level to support the country, to identify as well what are the artists, are willing to support social prescribing, and as well at regional level and at international level to be sure all this initiative project will be visible and will be valued. So we are able to support the country with art creative workshop to really create a music art workshop specifically with, for example, children or the most vulnerable or marginalized population. And all the artwork will be created through this creative workshop, will be showcased through international art exhibit. And we will produce one this year in the Geneva Health Forum on planetary health and one sustainable health. And the name of the exhibit will be Art to be Alive. So it's really an honor to demonstrate the value of all these people working so hard, at country level. And for this exhibit, we will have around 60 artists worldwide and as well contributors. So it's extraordinary when we are able, in very effective way, just because we want to work together with co-creative way, and everything at this with this method is becoming possible, in fact. And we want as well with this type of incubator to accelerate, the impact, the effect worldwide. And for that, this effective linkage between country, regional, and global level are absolutely necessary. Sometimes, you have some stakeholders are working hard, at local level or country level, but they are not, value at regional or international level, in systematic way, how to do that. And specifically, it is only possible when we will bring all the partners, in really collaborative way, not in competitive way. And it is for this reason, this model of consortium, I think it's very good, because the consortium, you have these partners, they will identify how they can complement each other, how they can be more stronger together without destruction, without competition. So that, I think, it's really a change in terms, again, of implementation. And the beauty, it is as well the way to build multidisciplinary and multi-sectorial networks. And for sustainable development goals, we cannot, continue to work silo by silo. We need to interface, in effective way, the sector together, but as well the people in charge of this sector. Because if they are not convinced, collaboration, co-creation is better than competition, we will never, make a change. It's impossible. So it is really the value to bring together artists, patients, communities, health professionals, policymakers, researchers, entrepreneurs, all these players, and they are not in competition. They are totally in complementary, way every day. So how to find, this type of effective linkage. So that it is really the big focus, in fact, of this incubator, and to demonstrate it in practice. And after, of course, the idea is really to continue to develop, to have really this learning experience. It's always about experience, and really to have an interest to know from all the stakeholders what have been your pathway, how you have reached finally this type of well-being. If you have, this well-being, how it was done, what have been the step in the process, because it's not just about, the final destination. It is about the process you have done, and to appreciate the different steps and to learn from this step to share with those. And those, the final step for us to continue to expand, it is really systematically to identify and map at worldwide level all the art programs or initiative, have really amazing impact, and not just on short term. And that it is a way for us to demonstrate and to showcase very practical solution, what I have explained specifically with international art exhibits. It's totally a new way to design finally art exhibit, because it is to have something more alive, and putting the people in front of, in the center, I will say, people in the center. And for that, with the partners, how you will establish this linkage I have mentioned to you. We need to have, for example, some chart, specifically to co-create together. If you have not, the spirit behind, it's impossible. So what we are looking for to be sure, the partners have really understand what it is, the concept of co-creativity, and decide to go for it. But it is as well the level of resilience, they have, specifically after the description of the pathways they have reached. It is about our humanity. It is about social prescribing. It's to put again human in the center. It is about the use of empathy. Without empathy, we cannot understand each other. We cannot reach this universal value will be common to all the humanity. It is about the harmony we will develop, but as well humility and the transcendence finally we will achieve together. So that it is really the key elements I want to present to you. For example, about the project and the impact of this project, you can see on this slide. And we have been to really accelerate, the impact in just in 5 years. and to really target the real beneficiary, specifically the patient, but to have this extraordinary articulation as well with the partners, the artist, and globally the population, the society. And what we have assessed from this program, it is incredible skills can be, can be revealed. In fact, when we are perform, for example, this art creative workshop, for example, the sense of belonging, the self-confidence, the fluent and inspirational communication with others, and what we are looking for, the social inclusion and the cohesion. So that I will not go, I have no time to enter in the details, but it's just to show you we are able to measure as well the impact of what we are doing. And for that, we are using additionally framework, for example, this one about everyone include framework based on how you can measure, the level of curiosity, safety, and diversity in the same time. I will not go in the details. And here it's just to show you this picture to illustrate, for example, what we have done recently in Mexico, how we combine, in fact, the participation of local artists with us, how they teach, in fact, these children with, here in this case, have this issue of cleft, and how with this technique they have this sense of belonging and to create this community between each other. And we combine as well with some mural painting inside of the hospital to give more, happiness and positivity, in these health settings. And finally, I will just to conclude my presentation with this recent amazing quotation from patient, the patient of palliative care at the end of life. This patient and this quote will be presented during the international art exhibit in Geneva Health Forum about the name about art to be alive. And I want just to finish with these 3 sentences because it's so powerful and that will speak for itself, for the conclusion. And the first, it is from Shane, 47 years. Putting words on my heels allows me to be less hard on myself and to learn, finally, to love myself. And Liliane, 69 years old, since the day of my birth, I had to fight to live. Today, I can finally appreciate who I am. And René, 19 years old, if I have learned anything from life, it is to always believe in the beauty of human beings. Donc I think that speaks, for itself to finish, this demonstration, how it is important to consider art as well in the medical setting, additionally to the medical practices. Thank you so much.
Thank you so much, Isabel, for a very insightful presentation. As a dancer, I can really appreciate the importance of art in health and well-being of artists. Thank you so much. We're kind of running behind schedule, so we probably have to skip the question from Ruthen. Maybe that's something you can follow up on Twitter. I believe is I can send you to your Ruthen. If you contact my LinkedIn, I can send you the the Twitter page of Isabel Washmuth. Thank you so much, Isabel. And and then also thank you for Sian, and thank you, Dorian, for your support. And without further ado, let's have our next speaker, Professor Sir Michael Marmot. Big fan of your work. For people watching here today, if you haven't had Status Syndrome and the Health Gap, you haven't learned anything in life as a pharmacist, highly recommended you buy those 2 books to really understand how the whole social determinant of health works, which also impact social prescribing. And Professor Marmot, the floor is for you now. I don't know if you're able to share a screen, maybe, if you got slide.
Yeah.
Thank you. Thank you, sir. Yeah.
You can see that Okay.
Yes, so we can see your
Good.
screen.
Well, I'm going to put social prescribing in context to speak about the problems that social prescribing at some level is seeking to address, which is health equity and inequalities in health. In February 2020, just before the pandemic crashed upon us, I produced this report, Health Equity in England, the Marmot Review, 10 years on. In 2010, I published Fair Society, Healthy Lives, the Marmot Review, setting out what was needed to be done to address health inequities. 10 years later, I look back what had happened in the last decade, and the answer was not encouraging. Life expectancy, which had been increasing about 1 year every 4 years for women and for men, I've taken it back here to 1980, I could take it back to 1900. For a century, life expectancy had been increasing 1 year every 4 years. And in 2010, there was a break in the curve, and the rate of increase slowed markedly and just about ground to a halt. Something changed. And the inequalities increased. These are different regions of England. If you're rich, if you're in the least deprived 10%, this is women, but it's similar for men, it doesn't much matter where you live. Life expectancy, the regional variations are small, and life expectancy was improving a bit. For the most deprived 10%, big regional variations, life expectancy was improving in London and getting worse, declining for virtually every other region outside London. So this is where we were before the pandemic. Health had stopped improving. Inequalities in health were increasing. And life expectancy and healthy life expectancy for the poorest people was getting worse. That's really not supposed to happen. And to show you the regional differences in more detail, here's the social gradient in life expectancy. The greater the deprivation, the shorter the life expectancy. The top graph is London, and the bottom graph is the Northeast region. For the least deprived 10%, very little difference between London and the Northeast. And then the greater the deprivation, the greater the disadvantage of being in the Northeast compared with London. The gradient is steeper. And that means if we want to address the conditions in which people are born, grow, live, work, and age, the social determinants of health, we have to recognize that this National Index of Multiple Deprivation is more predictive of ill health and shorter life expectancy in the north of the country, northeast, northwest, than it is in London and the southeast. And if you look, the dotted line is life expectancy in 2010-12, the solid line 2016-18, and life expectancy has improved for London across the gradient. In the Northeast, it went down for the poorest 10%, no improvement for the next decile. In fact, for the bottom 6 deciles, it either declined or no improvement. And then only in the top 40% is there some improvement. So this is where we were. Then came the pandemic. And the pandemic revealed the underlying inequalities in society and amplified them. Here's the social gradient in mortality from all causes. And there's the social gradient in mortality from COVID-19. It's almost identical. Almost identical. So in thinking about how to deal with this, I want to deal with what I call some apparent opposites. Should we think of this as a social problem or a medical problem? And in fact, when I put up these apparent opposites, the answer is usually both. It is a social problem and a medical problem. Thank you. You held up a copy of my book, The Health Gap, the opening line of which was, why treat people and send them back to the conditions that made them sick? We need to deal with the conditions that cause that social gradient in health that make people sick. But we also need to work through the healthcare system. I was involved in helping nurses put together a report on what nurses can do to tackle the social determinants of health from within the healthcare system. And social prescribing is part of that. Addressing people's needs in a holistic way. Disease control or social determinants. I showed you this, the social gradient in COVID-19. So the disease control approach says, well, we've got vaccination. We don't need to do anything. It's all over. We've solved it. We've got vaccination. That's, of course, neglecting the fact that first, there are these inequalities, and second, the hospitals are full. The NHS is overburdened. Hospitalization rates have been going up. It is not the case that all you needed was vaccination. And I was talking to a group of oral health experts, and I put up this graph: deprivation, social gradient. You can't read it. It's the gradient in caries, dental caries in 5-year-old children. It looks identical to the social gradient in COVID-19 mortality. Then I was talking to a group involved in primary prevention of cardiovascular disease in primary care. So I put up this graph. It's obesity prevalence in year 6 by deprivation. Identical social gradient to the COVID-19 graph. What's going on here? COVID-19 is caused by a virus. Dental caries, we think, is diet, poor oral hygiene, low fluoride levels. Obesity, diet, exercise, stress in children, but not a virus. So yes, we do need to control the disease, but we need to recognize the social determinants of the social gradient, whether it's COVID, dental caries, obesity, diabetes, cardiovascular disease, many cancers. So if we're going to look at social determinants, the 6 domains of recommendations in my 2010 report, Fair Society, Healthy Lives, that I revisited in 2020, give every child the best start in life, education and lifelong learning, fair employment and good work for all, having enough money to live on, highly relevant, given the cost of living crisis, healthy and sustainable places and communities, and taking a social determinants approach to prevention. I was struck that in the first wave of the pandemic, we in the UK had the highest excess mortality of any country. Excess mortality is not just COVID-19. It's asking how many deaths, total deaths, you would have predicted based on the previous 5 years, how many were observed, and the difference is the excess. And the UK had the highest excess mortality of any rich country. And I asked myself, what's the link between where we were pre-pandemic, life expectancy stalling, inequalities increasing, and life expectancy for the poorest people falling? And that slowdown in life expectancy improvement was nearly the slowest of all rich countries. Only Iceland and the United States had a slower improvement. And then during the first wave, at least, of the pandemic, we had the highest excess mortality. And I think the link works at 4 levels: poor governance and political culture. You probably haven't had a moment to tune into what happened in Parliament, the British Parliament today, if you want to see poor governance and poor political culture in action. Increasing social and economic inequalities, the reduction in spending on public services. We were ill prepared and we weren't very healthy, all of which would put us at high risk of the pandemic. Social determinants or individual responsibility. This is like a litmus test, isn't it? Politicians on the right say it's individual responsibility. Poor people have only themselves to blame. People on the left say, no, it's social determinants. There are social causes. I say, let's look at the evidence. There's an NHS Eat Well guide, what you need to eat to stay healthy. For people in the bottom 10% of household income, to eat healthily, they would have to spend 74% of household income on food. If they try to eat healthily, what are they going to do about heating the dwelling or paying the rent? Don't blame the poor for their poor eating habits. Blame their poverty. Targeted or universal? The default position of British social policy is to target the worst off, spend money where it'll do the most good. I was speaking earlier today to public health people in Sweden. The Nordic approach is universal policies. I tried to combine them with what I called proportionate universalism. Universalist policies with effort proportionate to need. You could even call it leveling up. So if this was less deprivation, more affluence, and life expectancy, for example, there's the social gradient. If you only target the worst off, you miss the health disadvantage of those below the top. That increases with greater deprivation, but it's not as bad as those at the bottom. So what we want is universalist policies with effort proportionate to need. That's what I said in 2010. What did we get after 2010? This is spending per person in local government. The grey line is total local authority spending. In the least deprived 20% of areas, the spending after 2010 went down by 16%. And then the greater the deprivation, the greater the reduction in spending. In the most deprived 20%, it went down by 32%. What we've got here is effort inversely proportionate to need. The greater the deprivation, the greater the need. The greater the need, the greater the reduction in spending. Could this have played a role in the worsening health, the increase in the poorest people, the increase in inequalities, the slowdown in improvement? Yeah, I think it could. And this question, central or local, relates crucially to social prescribing. What can you do at the individual level or at the local level that should be done at the central level? Well, the central level matters. Here's child poverty. Child poverty is defined as living in a household at less than 60% median income. In 2010-11, before housing costs, 18% of children were in poverty. After 2011, after housing costs, it was 27%. And over the decade, that 27% went up to 30%, is predicted to go up further with the cost of living crisis. How was that achieved? Well, this was action by the Minister of Finance, by the Chancellor, changes to tax and benefit reforms by income. So look, the red is working age with children. If you were in the poorest household, in the poorest 10% of households, your income would go down by 20% as a result of changes the Minister of Finance made to taxes and benefits. If you were in the second poorest decile, your income would go down by 12%. And then the richer you were, the less the reduction. So yes, central action really matters. But we've been working on the assumption that local action matters. And this is where social prescribing can come in. Coventry declared itself a marmot city. We did a report for Greater Manchester, Build Back Fairer in Greater Manchester, Health Equity and Dignified Lives, Luton, Waltham Forest, Lancashire and South Cumbria Health and Care Partnership, Cheshire and Merseyside Health and Care Partnership, East London NHS Foundation Trust. We're working all around the country at local level. We just published a report sponsored by Legal and General, which was arguing what business could do. And we want to include business in these place-based partnerships. And social prescribing can do a great deal to my 6 recommendations: the best start in life, education and lifelong learning, fair employment and good work for all, healthy and sustainable, healthy standard of living, healthy and sustainable places in which to live and work, and taking a social determinants approach to prevention. But we also need action at the political level to address poor governance and political culture, to reverse the increasing social and economic inequalities, to reverse the reduction in spending on public services, and to deal with the level of ill health. One recommendation: put a fair distribution of health and well-being at the heart of all government policy. Thank you.
Thank you so much, Professor Michael, for this presentation. I mean, the moment I've started reading your book, first I saw your keynote speech for the Royal College of GP Surgeries, I think, and it was shared by Professor Ellen Stoke on LinkedIn and Twitter. And that's when I found out about your work. And ever since, it really changed my perception on how pharmacists could contribute to the social prescribing ecosystem and social determinant of health. And it's a huge honor to have you here today. And I think there might be a few. So a huge thank you from Ellen Anderson, and I believe also everyone here today. And she's saying that she's completed a master's in public health. And likewise, you inspired me to look into maybe doing a PhD in social prescribing and epigenetic. Epidemiology. So thank you so much for that. And since we have a very busy schedule, I would love to ask you some more questions, but at this point, I'll probably just leave it at that. But yeah, for all the delegates here tonight, I highly recommend everyone to read this report, purchase this book, really absorb the content, because this was just like a tiny drop of ocean of knowledge he shared today. So thank you so much, Professor Michael Marmot. And now, so sorry, Sian, maybe that could be something I could share some with him later on. So now we're going to have our next speaker being Aragon from YOM, Your Open Metaverse. So Aragon, can you hear us?
And indeed. Can you hear me, Arun?
Yes, we can see you. So here you go. So for people that don't know about Your Open Metaverse, basically Aragon is the reason why I've got so involved in the metaverse, because he inspired me with his LinkedIn post, which eventually led me to become an ambassador for YOM. And also had the opportunity to do a podcast with him, which I highly recommend everyone to check it out after, not maybe tonight, but maybe later on this week to listen. And without any further ado, the floor is yours, Aragon.
All right. 2019, I was at perhaps the second peak of my professional life. I was self-employed, or I could even say I had my own business as an entrepreneur, and things were going quite well. I decided that I was going to take a business loan because things were going so well. I'd already confirmed a whole year's worth of revenue for the next year, the year 2020. It was going to be amazing. So, since I already confirmed all that revenue, why not invest? Why not try to lift it all to a higher level? So, I made some calls and I took out a massive loan and I bought a lot of cool equipment that you can actually see right now because I got an amazing camera and a microphone and all of that cool stuff. What I didn't know and what I didn't expect at the time was that the world was going to change. It was going to change significantly. Only a few months later, there was suddenly this news from China. There was a virus on the loose. Things were looking quite grim. But of course, China, that's on the other side of the planet. Nobody was getting worried about that. Not here in Europe, not in the Netherlands. But that all changed when suddenly there was news of people being sick in my own country. In a matter of weeks, everything changed. The world went into a lockdown. The Netherlands went into a lockdown. All events were cancelled. And my business was built on doing live training with companies, teaching them how to use social media, teaching them how to do sales, teaching them how to speak in public. And I would get on stage a lot, go to events. And just like that, it all changed. My company had no more income. All the revenue was canceled. And I had nothing to do except spend the money that I'd lent, that I borrowed to try and somehow get new business in. I tried to pivot. I tried a lot of things. But ultimately, within the first year of 2020, everything failed. And as a result, I started to fail. I started to break down. I couldn't go to CrossFit anymore. I couldn't work out. I couldn't see my friends. I was worried. I couldn't sleep at night. I lost my appetite. And at the same time, I keep getting bigger and bigger because apparently I was stress eating even when I didn't feel like it a lot of the time, but I would do it without thinking. And ultimately, I landed in what was by far the hardest and toughest period of my life. A mental depression that took me all the way to the edge where I was not capable of getting out of my bed, not capable of living my life in a normal fashion, not capable of finding any solution to any of my problems. And although I was never, luckily, suicidal, I was really wondering whether this was it. Was this it? Was this the end? Was I going to be 38 and completely broke, fail, and turn, might even end up living on the street? That was tough. And so on Christmas Day, and this was already in 2021, I called the doctor, finally, because I didn't know how to move on. Sorry, that was 2020. I got an answering machine because it was weekend. There was no one there. And I didn't really expect to get a call back until Monday after Christmas. Now, luckily, I have a very amazing GP. And so the next morning on Sunday, the first day, I think it was the second day of Christmas or third day of Christmas, I'm not sure. But I got a phone call and they said, Aragorn, we want you to come in today. We need to talk to you. And they asked me, questions. I don't know how it is in other places in the world, but in the Netherlands, they ask you what's going on and they ask you whether you're suicidal. They need to check. They ask you whether you're on drugs and all of that stuff. But they really let me know that they cared. They wanted to help me. So I left the doctor that day and I felt that I was finally going to get help, the help that I really needed. And then the waiting started. First 1 week, then 2 weeks, then a month, then 2 months. Finally, it took 4 months before I finally got word back that I was allowed to schedule an intake conversation. But the situation was that in Amsterdam, all the social care, the healthcare system for mental healthcare was completely overtaxed. We just heard the professor speak, and he spoke, about everything that happened also during COVID, and how, the weakest people in society are hit the hardest. And something just like that was happening, not just in traditional healthcare or standard healthcare, but also in mental health care. People from everywhere had nowhere to go, didn't know what to do with their lives, didn't know how to deal with the hardship that they were suddenly facing, didn't know how to deal with living all day long with their partner that they thought they knew, but then when they actually lived with them 24/7, they didn't know that they really knew. People were suffering from, their relationship with their kids, because even though they loved their kids, they suddenly had to work from home and the kids were always there and not going to school. It's crazy. And, it's very easy to say to all of this, yeah, okay, these people are just a bunch of snowflakes. But the truth is that you don't really understand until you're in that situation yourself. Mental health can be an extremely fragile thing that only depends on certain things in life being right, okay, and taken care of. And when those fall away, it can take an incredible toll. And it can completely wipe away the complete foundation that you have in life. And that's what happened to me. It took 4 months to get my first meeting. And then it took another 3 months before I got my first session, and another 4 months before I got my first group therapy. Fast forward to today. This is the year 2022. I'm okay. In case you guys wondered, I made it. I'm back. In the process, I learned that I am bipolar. I don't have the craziest, strongest version. I don't have bipolar. I don't know in English. It's called level 2 in Dutch. But nonetheless, it has a significant impact on my life. And I was happy that eventually I could learn how to deal with it, and I could learn how to master it. And now I also learn, even if another lockdown comes, what I can do to avoid going into a depression like that. But what I did realize throughout this period is that even though I always thought that things were well taken care of in the Netherlands, that we had a great healthcare system and that you could get help for anything, the truth that I realized was that even in a country like the Netherlands, that is by all measures around the world, extremely prosperous and wealthy with an amazing healthcare system, it took months before I could get the help that I needed. So I can only imagine how hard it has to be for people in other regions in the world. As a part of my recovery, I ended up working in this company called BeamUp, which is building what we call your open metaverse, which is a layer 1 metaverse. Now, why is that important? Well, apart from it being my absolute passion, the reason all of us at your open metaverse work on this is because we believe, and grab your chair and don't fall off, but we truly believe that the metaverse can be the solution to the human condition. A lot of people are going to say that we're crazy. A lot of people are going to say that it's all just a marketing thing, and that, no single technology or anything like that can really change a human condition. But I truly think that we are at the precipice of a paradigm shift in the world. The pandemic has shown us that we are way more fragile than we realize as humanity. We know that ecological disaster is just heading our way, is already underway. We might all be in one of the biggest extinction events in the history of the planet. And we also know that our economic system is on the verge of collapse. And if you don't know it, then I recommend you start, reading some books on it, doing some stuff. What I can really recommend the book, The Price of Tomorrow with Jeff Booth. But we're heading for absolute disaster. Now, the bad news is that I think none of us will be able to truly avoid it. People that are alive today, that are not already in their 60s or 70s, will, over the next 2 or 3 decades, have to deal with a lot of shit. In fact, I think it's only going to get worse before it gets better. And I know that's perhaps not the message that we were all hoping to hear today from me. But here's the good news. If we look back in history, whenever there have been periods like this, when things were really, bad, and there was a lot of suffering, we always ended up stronger and better for it. So if you're still young today, you can hold fast to the thought that if you make it through the next decade or 15 years, then after it, you will go into a golden age. If you're older like me, you're also still going to be part of that. If you have kids, you know that they will be a part of that. And we've already started that today. The metaverse, I mean, my company is a metaverse, and I know that a lot of people think, you know, it's a lot of bullshit. But let's quickly take a few minutes to think about what is the metaverse. So it's not just a three-dimensional new version of the internet. It's also not just, you know, a game for grown-ups to play in a virtual world. Maybe some in the future we will, you know, enter it through virtual reality, but initially it's not going to be about that. The metaverse is about interoperability. It's about peer-to-peer networking, and it's about it's about three-dimensional space and being present there, but not necessarily with virtual reality. Another word used for that is used in the medical spheres when they talk about metaverse is telepresence. And telepresence has a lot of advantages and can be used very successfully when it comes to healthcare. So it's good to realize that the metaverse is not just a virtual, you know, kind of game, but there's these certain aspects to it, like interoperability, peer-to-peer network, and telepresence. Now, what does that mean? What does interoperability mean? Well, interoperability means that because we're using technology like the blockchain that has really enabled us to do incredible things, that also enables us to connect systems in a way that is safe and allows for the retaining of privacy when it comes to personal data. Now, why does this matter? Well, think about it. How do we go about, you know, personal patient dossiers for people in the healthcare system today? If I am a citizen of the UK, I'll have a dossier there with my doctor, with my GP, and it might even be electronically connected with the hospitals in the UK. But if I go abroad, it won't come with me. A hospital in the Netherlands or a hospital in, I don't know, Austria, if I'm there on a ski trip and I break my leg, they would have to get that data from the UK, which takes time. In a world that uses metaverse interoperability, we will all get a super profile that we can control, that we can own, that will be on a wallet, on our phone, just like an NFT or just like crypto. But it also means that we have complete control over it, and we can take it anywhere. So it will be up to date, always saved in a blockchain under our full control. We can access it through our phone. So if we have an accident or anything going on and we're abroad, we can always access it and instantly share relevant data about our health, for example. Another thing the metaverse can provide by the same measure is that telepresence that I talked about. Think of a world where me having my mental health care problems in the Netherlands and having to wait until a healthcare specialist is available to help me, don't need to wait because my patient dossier is available on a blockchain, and my hospital and my doctor here are connected to a network across the world and allow me access to that. So within, you know, a few minutes, we can find out if there's a healthcare professional, perhaps on the other side of the planet, maybe in India or in China, that is actually available to start talking to me, do my intake, and help me with my mental health care problems. So I don't have to wait 4 months. Maybe for some people that might have been too late, you know? And I can still meet with that person through virtual reality, but also maybe just through my phone. I know that this is possible because even when I worked at LinkedIn in 2015, I already had virtual meetings with my doctor if I was sick, so I didn't have to go to my doctor. But that was a national system. Through the use of blockchain and metaverse interoperability, we can do that on a global scale. Another thing that we might use the metaverse for is how it combines 3D presence with artificial intelligence. You could do a physical self-examination under the guidance of an artificial intelligence in the very near future that will guide you to check the right things about your own body, that can tell you where you have to press, where you have to touch, what you have to feel, give descriptions. We already know that artificial intelligence in healthcare today can more accurately diagnose some illnesses with people than a real doctor can based on the right level of data input, if you have all the data available. The point that I'm trying to make is that there is lots of options. I haven't even spoken yet about the future, for example, of digital twins. I foresee a future within the next 5 to 10 years, where each of us will get a virtual digital twin based on our genetic code, if we are willing to share that through blockchain technology, where a doctor can actually run tests on our digital twin to see how we will react, how we will recover from surgery, all of that. Now, the question here, and that's what I want to finish with, is how does all of this tie back to social prescribing? Well, if we listen to the presentation from the professor before me, I lost his name for a second there, but we see that there's a big divide between healthcare available to, the better off, the more wealthy, and the people on the lower end of the spectrum of wealth. But I believe that the metaverse is the start of an age of more abundance. And the next few years, next decade even, might still be a tough period with economic change and upheaval, etc. But ultimately, this technology, the deflationary power of the metaverse technology, the combination of artificial intelligence, with blockchain, with spatial computing, that all will inevitably be such a strong deflationary power in terms of technology that it will allow for abundance for everybody. Imagine a world in where everything that you need to interact with in your home, like, for example, this computer screen that I'm looking at, or this, well, the microphone's not a good example, but computer screens are, or my keyboards here, etc., can be virtualized. If they're virtualized, they don't need to be produced, right? That means that there's no production cost. That means that they can be available to anybody. If we can virtualize, the doctor's assistant to help us diagnose what's wrong with us, there will be, we don't need to wait for a human one to become available. And if we really need a human one, we might be able to use the metaverse to get one from the other side of the planet if one is available there, but not over here. And I'm just thinking about simple things. The deflationary power of the metaverse technology is going to create an age in which everybody will have access to the basics, and even more than that, of healthcare, no matter where you are, what you're doing, what your income is. And I truly believe that. A lot of people are going to call me crazy, but you heard it here first. So as we're heading for an age of abundance, I have only one request for all of you. All of this can happen, and all of this cannot happen. It's really up to us. It's up to you and me to push the needle in the right direction. So I'm just going to ask you, do whatever you can to push it in the right one. Thank you.
Thank you so much, Aragon, for the presentation. Also, thank you for sharing your personal story. And you really kind of put a perspective, personal experience in going through a difficult time and how it was hard to get hold of healthcare, medical access. And Dorian is saying, thank you for sharing your story. So Dorian, unfortunately, because of timing issue, because you have a lot of speakers, maybe that's a conversation that could be carried on social media. So I'm more than happy to provide you the Twitter handle of Aragon so you can ask that question. And I highly recommend everyone, if you're truly passionate about the metaverse or getting interested into it, is to potentially attend a weekly meeting in Old Space every Wednesday, I believe. And then there's a roundtable discussion every two weeks. And I believe there is normally the State of the Metaverse podcast every Friday. And I think there's one coming up this Friday. And I highly recommend everyone to kind of attend every week, because it's kind of building up on your knowledge and give you insight on how you can get involved and pushing the needle forward in the pharmacy social prescribing mechanism. And Aragon, first of all, thanks again for this presentation, because it's quite late in Netherlands. It's like 9:44 yet you're here today to support us. So for this, thank you. Halford, thank you.
It's my pleasure.
Thank you.
I'm trying to answer the questions in chat now.
Okay, thank you so much, Aragon. And yeah, so without any further ado, we're going to have our next speaker, Nacho from Third Web. So Nacho, can you maybe share your screen? Can you hear us okay?
Yeah. Okay, here. Sorry, I have three screens. I'm just getting lost in myself. One second.
No problem. So for people that don't know Third Web, basically I only got involved in the metaverse NFT movement last December when I read his book from Gary V, 12.5 Ingredient. And there was a post about Third Web, which he showed like a 2-3 minute video on the evolution of Web 1, Web 2, Web 3. And that's when I kind of joined the Discord channel, and Nacho was very helpful with new beginners like me to get started. And actually, for those that don't even know about it, I created the first link worker collection where I handled the design myself, and I was able to use a third-one platform to make it blockchain ready for people to mint the NFTs with no coding whatsoever. And that's why I was so happy to have Nacho here today, so he can show his amazing platform being Third Web on how pharmacists and pharmacy students with no coding whatsoever can launch your own NFTs and then also your own token, for example, the social prescribing coin. And without any further ado, Nacho, the floor is yours.
Yeah. Sorry, I'm trying to share only a portion of my screen.
No worries.
But that's kind of, I'm sharing a very small portion right now. I can share my my whole browser. That should be fine. Okay.
Perfect.
Okay. Back to where I was. Hello. Okay, let's start. Hello, my name is Nacho. Yeah, thank you for the nice introduction. I'm a front-end engineer at Third Web, and then I do some other stuff, some nervous stuff, some sales stuff. It's always fun to mix it up a little bit. So yeah, we met like, I don't know, it was like 5 months ago, or something like that. You were kind of at the start of like when we officially launched back in December, and you launched that social token. So I kind of wanted to you invite them here. I thought it was great because you kind of want to bring Web3 to the masses, right? And for people that are not used to it, but they have heard about it maybe, or maybe they haven't heard about it. So that's kind of where I'm here to say, hey, okay, let's talk about Web3. What is Web3, and how can you actually use it in your company, in your product? How can you integrate it, and how can we create good stuff? So I kind of want to talk about what we do on Third Web, and then some examples of things and companies that have been built with us. So kind of just put an example of what we can do. So Third Web make it easy for teams to build Web3 apps, and this is an important thing. So there are many tools out there that they allow you to release your own NFT drop, maybe, right? So you have like your typical profile picture. You say, hey, I want to release 10,000 NFTs. If you don't know what an NFT is, I can go a little bit different to that. I don't. But the NFT is what it's called a non-fungible token, which means you can have two different pieces of art or different access tokens, but they are not interchangeable between them, right? So you have your own specific access token, your own specific piece of art. So this can be used for many purposes, right? For example, you can have it as only people that hold this NFT can access a specific website, or can access like special features in your product. So what we have is like, with the blockchains, like have different layers, which what we call the smart contract layer, which is the blockchain itself. Then we have the SDK layer, which is like one layer that we built on top to make it very easy for people to not have to know this very complicated language like Solidity, and they can use programming languages that they know and love, like JavaScript and Python. But then we have our third layer, which is like our dashboard level, which is like, hey, if you don't even know how to code, if you haven't written a line of code in your life, you can still do all of this through our Third Web dashboard. So, and then when you do with us, you make sure that the code is secure, the code is optimized, and you don't have to worry about all the difficult things, or having to hire a dev team that's going to cost you thousands of dollars. We're completely free to use, and we don't take any money from you if you make any sales. If you make money, you keep all the money that you make. So this is kind of what I was talking about. Like, this is we live on every layer, every layer. So it's the blockchain layer, the contract layer, the SDK, and your app. So we connect to the blockchain through our contracts. And don't worry about it if you're not familiar with smart contracts or SDKs or all that stuff. The thing is, like, there's many layers of complexity, and we make it easy on every single one of them. But as I said, if you don't know anything about blockchains, if you don't know anything about smart contracts, about NFTs, about tokens, you can still use us in a very easy way through a dashboard. So what can you do with us? And this is an important thing, right? So I mentioned NFTs, I mentioned like access tokens. So you can create NFTs with us. You can create your whole collection with us. And there's like different types of NFTs. If there's NFTs that only one person can own each one of them, but there's some NFTs and you can say, hey, for this specific NFT, I want to give, for example, the same level of access to 1,000 people. So I'm going to have this specific NFT to be able to be, which is what we call minted by 1,000 people, right? Or also maybe you create many different NFTs and you say, hey, I want to be able to sell them, but on my own rights. I don't want anyone, like any marketplace, to take a cut. I want to charge 0%, or I want to charge 1%, but I want to charge it myself, not some other marketplace. So you can create those marketplaces with TheraWeb. And then we have drops, which what we call drops is like, instead of you creating all the NFTs and then selling them yourself, you can make it so your audience it's what we call mint them. So they are the ones adding it to the blockchain instead of being you. Which what it does is like, this is the typical thing that people usually do. Like they like, for example, as he was saying, he did for Social Prescribing, he did this drop so that his audience could mint the NFTs and hold them directly instead of him having to create them and sell them and gonna go through the whole process. So we make this very easy. And one important thing, especially for teams and companies doing this, it's what we call the split. And basically, this is a very like trustless way of sharing revenue. Imagine you say, hey, I'm gonna release my own collection in the blockchain. I'm gonna make $10,000. I'm gonna make $100,000. But I want to keep 20% to my team, or some other person on my team, or they want to give me that percentage, right? How do you make sure they're gonna give you that money? So with the split contract, it's very easy, because basically what we do here is like, we ensure through the blockchain that you're gonna get that money, which you have to trust. You don't have to sign any contracts. You don't have to trust anyone that they're gonna give you the money. It will go automatically verified to the blockchain. So that's a very nice feature of it. And this kind of ties very well with the permissions that we offer. So it's very important when you create something, right, that you and this is very common in the normal development and builder war, right, that you say, hey, if I create a website, my admin is going to have more permissions, and then my developers are going to have less permissions, and then the marketing people are going to have different permissions. So we offer a very easy way for teams to have different levels of permissions, so not everyone has the same level. And this is something it's very rare and very new on blockchain and blockchain development apps, but something we offer all with TheraWeb. So as I was saying, like, there's many things that you can build. I spoke about the different types of contracts, but then the applications, like a membership club. You can create these NFTs to say, hey, I only want people that hold this NFT and they have it in their digital wallet to be able to access this website or this Discord server, or maybe my real life event. I only want to have people that have my NFT to be able to come to my event. So many different things like that. You can create your marketplaces to kind of trade either your NFTs or other collections of NFTs. And you can create your own games, maybe, if you're interested in that, with not only NFTs, but also like tokens, what we call tokens, which will be like a typical Bitcoin, Ethereum, or everyone knows as token. So you can create this type of currency, either for your game or also, like, for example, you can create your own token, your own currency, and then sell that currency, and then sell your NFT later on that currency. So you can create, as I see, like very advanced build use cases, like from the different like puzzle pieces that we offer. And then important thing is like we are multi-chain. So on the blockchain, there's like there's not one blockchain. The most common, the most used one is Ethereum. And this kind of, if you are a little bit familiar, it's like with crypto, it's like what you have heard about. It's like, hey, Ethereum price goes up, Ethereum price goes down. And that's kind of what people know and have heard about. There's a lot of concerns with people that Ethereum has like some environmental concerns, and it's just very expensive to use. So there's other blockchains like Polygon, Avalanche, and Phantom that we are available on right now that have cheaper development costs, cheaper deployment costs. So for example, just to give a quick comparison, for example, minting an NFT on Ethereum will be like something like $30 to $50, or maybe $100, depending on the traffic, or like how many people are doing it at the same time, right? Compared to like Polygon, maybe it will be like 10 cents. So it's a very big difference. If you want your collections to be accessible for everyone in a very cheap way, to not having to pay just that amount of money that's gonna go nowhere. Basically, it's not gonna go to you. It's gonna be the price that you set plus that fee just for doing the operation. So having these other blockchains like, let's say Polygon is the most popular one, but Avalanche and Phantom 2 that are much cheaper to deploy and create whole applications. It's a very nice things for your audience. And then, as I was saying, we power builders and on many different fields. So we go from esports. We work with like game development companies. We work with developer agencies, because sometimes we get people that say, hey, I want to build this, but I also want to build my own website and I don't know how. So we kind of partner with some agencies to kind of help you go the whole way and just helping you build the whole thing that you want. And then we have many Web3 startups that say, hey, I'm not coming for the old world, the Web2 world. I'm coming for everything new. I'm creating a new app from scratch. Like for example, Superlocal, they do NFTs that only can be claimed if you are in a specific location. That's a very interesting use case. Like Wombo, for example, they do AI generation of like you upload your own image and they do AI generation, and they do like videos with your face, singing and stuff like that. And then they also offered some of that as an NFT if you want to get it. So these kind of use cases that we're powering are very interesting. And then just kind of to showcase one of those launches we did is 100 Thieves. 100 Thieves is a very big esports organization. It's their League of Legends team, and they did one of the biggest NFT drops on Polygon. So they created this NFT to commemorate their championship win. So the yearly tournament on North America, they won it in 2021. So they created this NFT to commemorate that to their fans. And what they did is like, it was very interesting because they made it very easy for people to get this NFT. And they did this in two different ways. One of them was allowing people that have never heard of Web3, have never heard of wallets, to create accounts and wallets with email or with social logins like Twitter, Facebook, LinkedIn. So any social provider, you could create a wallet with it. And that's super helpful, because even if you don't know anything, say, hey, this is going to be my first NFT. That's a very nice way of onboarding. So, and we saw from the 700,000 total NFTs that were claimed, 200,000 were first time new wallets that were created through social logins. So we see like how these type of things, like, hey, most people, they just don't know NFTs because they haven't got a project that got them really excited about it, like this championship project from 100 Thieves. So we've seen like a lot of wallets created from that. So it's definitely interesting. And the other thing they did, and that's also why they got so many claims and so many people involved in it, was that they did what we call gasless. So you remember that fee I told you about before on Polygon, which is like 10 cents. For that fee, you need to have the 10 cents on your wallet. And if you have never had a wallet, if you don't know how a wallet is, even if it's very cheap, you don't have it. And sometimes it's like 10 cents, but sometimes it can be like 2 cents or 3 cents. So it's very, very cheap. But at the same time, you need to have those funds in your wallet. So what 100 Tips did was taking care of that for the user. So instead of saying, hey, you need to pay 2 cents, say, hey, if you claim this, we're going to take care of that. And we're going to pay the 2, 3 cents, 5 cents ourselves. So they paid for all the 700,000 claims to make it very easy and seamless for people. So imagine you will go through the website, you will create your new wallet with Twitter, and then you will click claim, and they will pay for it. And then you will have a new wallet with a new NFT for free. So that was the whole experience, and it was a very seamless experience. And that's something you can do. So now, for example, they can say, hey, I have a website that it's only for NFT holders, or a Discord server that it's only for NFT holders, and you can kind of create different stuff with it. They, for example, could say, hey, if you hold this NFT, we're going to give you 10% off on our merch. So they can do these kind of different things in a very easy way by taking the ownership of the NFTs that they have. And that's basically it. That's a kind of showcase of like what ThreadWeb does, what we do, a little bit of Web3. I know I said a lot of buzzwords. I try not to say too many or kind of explain them as I go. But yeah, like if you have any questions, feel free to reach out by email at nacho@threadweb.com or our Discord. It's like the discord.gg/ThreadWeb. We're very active. They're on Discord, a community of more like 30,000 people. And then follow us on Twitter. We are like also more than 30,000 people on Twitter. So super happy like being here. Like if you have any questions, feel free to send. I'm happy to answer them.
Thank you so much, Nacho, for your presentation. For people here tonight, it might be a lot to take in, but I'm telling you, NFTs and ThreadWeb is really going to be a big toolkit for pharmacy team members to really have this personalized approach to patients. Just an example to on top of my mind, you could create like a membership for specific patient group, one for diabetics, one for asthmatic patient, and then having like this membership club where you could provide dedicated advice for the specific patient cohort. And it's only going to really get the coin to drop in, to really sink in, is when I'm going to play the recording of Dr. Jane later on, who's the last recording, which talked about NFTs. But for now, all I can say to you is like, everyone just get to know more about ThreadWeb, go and play around with the platform to really get your hand into it. And definitely one thing you need to remember is don't try to do it with a live network. Play around with the test network first. So for people that don't realize what's the test network, live network is where you have to put your actual real money. But then if you make mistake, that could be expensive action. So you do use the test network provided by ThreadWeb, which is Mumbai, and also Rinkeby network, I believe. And definitely reach out to Nacho, join the Discord channel. And for this, thank you so much, Nacho. I think many people that are watching it tonight are all seeking in the word you've kind of told them. And after, I think, a few more weeks of them doing more learning about NFTs and blockchain, they're really going to grasp the potential of what you've taught to us today. So thank you, Mia, for your kind word. And so, yeah, thank you so much, Nacho. So great for your presence today. And yeah, do reach out to him, follow him on Twitter, hit him up, and definitely join the community of ThreadWeb, because they are really going to help every pharmacy and pharmacy team members to really take advantage of Web3. Thank you, Nacho.
Yeah, it's a pleasure.
Thank you. Without any further ado, we're going to have our next speaker, Professor Thais Rusamono from the space industry. Professor Rusamono, can you hear us okay? Yeah.
Can you hear me well?
Yeah, I can hear you.
Okay.
So first of all, thank you so much for being here today. I mean, I still remember your presentation back in January, I believe, where you taught us about CPR in space, like zero gravity. It just blew me away. I'm so happy that you are happy for me to connect with you, and I agreed to be here today because another topic to explore is that there is social prescribing, of course, in pharmacy. Then they talk about the metaverse. But another thing that could be coming up very soon, I believe, with SpaceX, Blue Origin, Virgin Galactic, is application of social prescribing in the space, where there could be the role of space pharmacists specializing in space medicine, space public health, and also space social prescribing. And so yes, Professor Samano, the floor is yours.
No, thank you very much. I will concentrate more today in some psycho-emotional aspects of space flight that, in fact, you asked me to talk about that. So a bit different from CPR in space. Let's just trying to get this. There's always a stress related to. Okay, so can you see my slides?
Yes, I can see your slide.
Okay, so thank you very much, first of all, for having me here, for inviting me. As it was said, my name is Thais Gusubano. I'm a medical doctor. My area of specialization is space physiology, aviation medicine, and digital health. And I'm going to talk today about space psychology, or the emotions during space flight, and the challenge related to that, and some lessons that, in fact, are in alignment with the last pandemic that we had here on Earth. Still have, I think, but everybody's more relaxed now. No? So first, I'd like to set the scene of what is to be in space. So we have to understand nowadays that the spacecrafts, they are very similar to what we have here on Earth in terms of atmosphere. So if you compare the first programs like Mercury, Gemini, and Apollo, we had a very low barometric pressure inside the spacecraft. So we had to increase the oxygen to 100%, which is not physiological, let's say. And thanks to the engineers, space engineers, it was getting better and better with time. And when you get to 1980, in fact 1981, precisely 12 April 1981, when the first space shuttle was sent into space, Columbia, we had basically were able to mimic the atmosphere inside the spacecraft. That's what we have nowadays at the ISS. So one atmosphere, 760 millimeters of mercury, 20% oxygen, 8% nitrogen, temperature is controlled, water vapor. What's not pretty well controlled, let's say, is CO2, because it's very difficult to ventilate, of course, the spacecraft, the space station. So that's our situation now. No? We have this, let's say, this ability to create the Earth's atmosphere inside of a space station. So when you are in orbit, it's called low Earth orbit missions or LEO missions, we need to be concerned with four main things. Microgravity, effects of microgravity that is created by free fall for the astronauts in orbit, radiation, the human mind in space, I'm going to concentrate a little bit on that, and the circadian rhythm is completely disrupted because we have in 24 hours, we have 16 sunsets and 16 sunrise, meaning that we have 16 days in one day, as the spacecraft or the space station is traveling at a speed of 27,000 kilometers per hour at about 400 kilometers in altitude. If you go to the moon one day, you are going to have no atmosphere, no oxygen, no water, no protection, lots of moon dust. We can still communicate very well. So digital health, telemedicine is going to be pretty much used to keep the well-being of people on the moon. We have to deal with the hypogravity of the moon. And when you go to Mars one day, we are going to, I hope we go, we are going to have more issues to deal with, not just the trip to get there, but we have an atmosphere that's very thin and full of CO2. So it's a toxic gas for humans. You have a low temperature, you have hypogravity. And then it comes one aspect that's very important in terms of psychiatry, space psychiatry, which is to see Earth from Mars as we see Mars from Earth nowadays. It's just a dot in space, and it's very difficult to predict what's going to happen in a human mind when we see our planet that is like a tiny dot in space, which is very maybe very shocking for the astronauts. So when we talk about space medicine, in space, I divided, this is not in textbooks, that's how I approach space medicine. It was my creation, not necessarily correct, but I think that it is. We have the adaptation, space physiology, and space psychology. So adaptation to space flight, which is more acclimatization, because for adaptation we need many generations, but it's called space adaptation to space flight. And it happens, if you want or not, during in short-term or long-term missions. You have operational medicine, which is more related to the logistics of a space mission. So where you sleep, or what to eat, and so on. And clinical medicine is when you get sick on top of all this stuff. So it's very, very important in terms of physiologically and psychologically to divide the space missions in short-term space missions or long-term space missions, because all the change in our body, in our mind, will depend on the time, the duration of a mission. So when you are, if you are in space for a week, or maybe even a month, it's completely different than if you are in space for 6 months to a year. Your body and your mind change much more, of course, if you stay for 6+ months. And also to consider men and women, which is not very well done till now, because we have like 600 people that went into space and just 12% are women. And you know that anatomically, physiologically, in terms of disease expression and even emotionally, this very different beings. No? So if you look at what happens to our physiology, all our body systems are affected. So you have here in this chart, you have each color, each line represents one body system, and you can see that some respond very quickly and very intensely, and then others respond not that quick, but continuously. Like let's take the blue line, the dark blue line is bone, so it's going to be, it changes continuously. So it is something that is a problem, especially in long-term missions. Neurovestibular system, the yellow line, it changes very quickly and adapts very quickly. So it is something that in a short-term mission you have to be concerned about. So it gives an idea for space doctors, how to approach someone that's going to travel into space. But taking the mind of the astronauts, it is something that's extremely important, not as studied as physiology. So space psychiatry, we need more brains studying the people in space mission in terms of their adaptation, emotional adaptation to that. So isolation, very important. You are not just isolate, but you have a lack of reference, complete lack of reference. You have your routine change completely. You don't have your friends, the normal place that you like to go, a restaurant, a bar, whatever. So everything changes, and it can change for a long period of time, 6+ months, as I said. There are the astronauts complain sometimes that they are overloaded in terms of work, but sometimes they feel that they are a bit, let's say, bored, lots of monotony, and it can lead to depression. This idea that you have 16 days in one day change completely your circadian rhythm, so the light and dark cycles are completely disrupted. And one of the most, let's say, complaints of astronauts is insomnia, so they take lots of medication to induce sleep. Many times communication issues with crew, within the crew, because of the diversity, different genders, different backgrounds, language, culture. So it is something that is it has to be better understood, because it is extremely important for the success of a space mission. Even the design of the habitat can influence the well-being of astronauts. Very recent, there was a publication of a study using radiation in mice, showing that the radiation, even if it's not an intense radiation, but similar to the one that say that astronauts are subjected to in a LEO mission, can affect cognition. So memory can be affected, which can impact not just the well-being, but the success of the mission. So if you look at this table, considering the clinical medicine, how astronauts, that when astronauts get sick in space, here is a summary of astronauts during the space shuttle program from 81 to 98. And you can see that all body systems, in fact, somehow presented a kind of clinical disease, gastrointestinal system, infectious disease, respiratory system, and so on. But if you look at this table here, you also have psychiatric issues. And the psychiatric issues in general are related to depression. So we think that, oh, you are an astronaut, you are happy, this is the goal of your life. And sometimes you achieve that. It is true, but you are, how can I say, a bit frustrated, with after a while in a mission, and then you become depressed. So one aspect that's very important is that that I mentioned, that astronauts don't sleep very well in space, and they have to sleep for 8 hours, and they sleep 6 hours, and I will show some aspects related to that. But you can see here that it's very uncomfortable somehow to sleep in space, because you can sleep in a vertical position, any position, but it is, although it doesn't matter in terms of gravity, it's counterintuitive to sleep in the standing position. And you have to cover your eyes because of the noise, the light, the noise. It's very disturbing to be sleeping in space. So there are lots of problems related to the sleeping pattern that is disrupted when you are in a space mission. And you can see here that it's not just the quantity that I mentioned that is affected, but the quality of sleep is also affected. And it created lots of problems in relation to performance and physical and mental performance and the well-being and health of astronauts, with decrease in cognition, operational performance is decreased, there are emotional changes, and so on. So it is something that, if not well treated or managed, it can create lots of issues, not just related to the health and well-being, but also the safety of the trip in general. So you have countermeasures that range from improvement of the sleep environment, the design of a work-rest schedule, pharmacological interventions, light treatment is also used, physical, psychological support, crew selection training before flight that will try to improve, let's say, this situation during flight. So sleep is something that affects mental health in space. In general, you have this pattern, that's the third quarter phenomenon, which is that you are very happy at the beginning, very happy at the end, but in the middle you have this dip, which means that you are feeling more slow, more depressed, and it happens especially during long-term missions. There are countermeasures that you can use, that are developed for space flight, like entertainment and some type of, let's say, socialization. Then when you are having a meal with your friends or playing music or games with not just your friends and colleagues in a space station, but also with your friends and colleagues on Earth. In 2012, this paper was published regarding yoga, mindfulness yoga associated to space flight. And this is something that I believe that will become more popular now that India is becoming a country that will be more active in terms of human space exploration, even sending astronauts into space. I believe that in the next couple of years. So yoga is something that you can do as a countermeasure as well. You can do exercise, physical exercise, which is very good for your body, for your bones, muscles, cardiovascular system, but can also influence your humor, your emotions by exercising every day. They have to do that 2 to 2.5 hours a day for 6 days per week. Space pharmacy, I mean, I think that it's would be a very interesting topic for all of you, but it is something that is not very well understood. No, you need much more research in this area. Believe me, lots of research in this area, because what we do is, in my opinion, very wrong. We just take the dose and those intervals of medication and export it to space missions, knowing that our physiology, our metabolism, everything is completely changed in space. So the pharmacodynamics and pharmacokinetics of drugs are completely altered. But in any case, we use the same type of we use the medication the same way that we use here on Earth. This is a salutogenesis, another way to create a kind of well-being of astronauts in space. So it is coined in 1979, which is the opposite of pathogenesis, and it is basically a way to give meaning to your life, to experience changes in life as something normal and beneficial, to somehow to control the environment. So it is a way to feel better, let's say. the key factor of salutogenesis is a person's sense of coherence. And the factors contributing to that are comprehensibility, manageability, meaningfulness, social support, spirituality, happiness, humor, love, and so on. So it's very important that you bring that positive attitude with you during space flight. If you are, you know that we know that our body, our mind changing with microgravity exposure and with radiation. So what can we do? We can basically train astronauts to identify these physiological and psychological changes in a space mission, plus adding also identifying clinical situations that can happen to astronauts, you know, when they get sick, so they can perform some minor procedures or collect data to send to Earth. It's important to understand that telemedicine, and I always say that in my talks because people believe that telemedicine started with space flight. No, it didn't start space flight. It started many years before space flight happened. And just as an example, Eindhoven, that invented the ECG in 1906, transmitted the first ECG. So a teletransmission of ECG happened in 1906, and in 1961, Gagarin had his ECG transmitted to Earth. So it was quite a coincidence that the same medical exam was the first transmitted on Earth and first one transmitted from space to Earth. So that's what we need to rely on: telemedicine, collecting data, sent to Earth. It's very possible when you are in low Earth orbit or even on the moon, because you have a distance from Earth to the moon of about 300,000 kilometers. So it is perfect for the speed of light to transmit data. It is, of course, sometimes you have a delay from the moon of 1 to 2 seconds, but from the low Earth orbit, it's basically real time. Then you can collect data from astronauts in regular interval, support during medical emergencies, and so on. When you are on Mars, it's going to be a different story, because you are going to range from 55 to 400 million kilometers, 3 minutes delay for each way when the planets are closer, and when they are 400 million kilometers apart, then it can be 22 minutes each way, which needs then other aspect or other solutions, not just astronaut training, but maybe to produce some tools in space, you know, for dental treatment or medical treatment. So to use the 3D printer for that, and have, of course, lots, and we're talking in this meeting about metaverse, artificial intelligence. We need that. If without that on Mars, we won't survive, because the distance, the problems with communication, and we need robonauts to be astronauts, to be doctors, performing minor procedures, even surgery if one day maybe, and helping with the diagnosis and treatment, management of situations, and even to being pets in space, you know, like this, the picture there of an astronaut and a robot that's a kind of pet, to improve their mental and emotional well-being. What is very important is what can we do here on Earth to better understand the psychological, space psychology, let's say, or the emotions in a space flight. We can use simulators like deserts or Antarctica expeditions, where we have these very hostile environments, either very hot or very cold, isolated somehow, with lots of snow or sand. And so to have these hostile environments and have groups of people interacting, or you can create, you know, confined space like this one here in the Utah desert, the MDRS, which simulates a kind of Mars missions, a Mars habitat, and then you can perform many activities inside and outside. Of course, here you don't have microgravity, don't have radiation, but now you have a way to create this environment inside and outside that can be very similar to Mars and the Mars environment and the Moon environment. There are many opportunities in terms of research with these expeditions, simulations of Mars habitats. This is the Austrian Forum that performs every 2 years, I believe, big missions involving people from different countries, universities, and so on, with experiments, and some of them are related to psychology and emotional well-being of astronauts. The most famous one was Mars 500 that simulated a trip to Mars. It was run by Russia with the support of other space agencies and universities. 6 men were selected, put in a kind of isolation for 520 days, in fact, and they simulate a trip to Mars, going to the red planet, coming back, and also performing some extravehicular activities, simulated their time on Mars. I believe very much in some very real experience to study humans, because it's very important for them to know that they are in a risk and danger situation, like in a submarine. But if not in a submarine, at least in NEMO, these extreme environment mission operations that NASA created, that is basically a way to use the ocean, this situation to mimic what happens with a crew on Mars. So it's a bit more risky than just a habitat constructed in a desert or in a Antarctica is also a bit risky. So just finalize, it's very important to understand this process and methods and technology and knowledge that we can transfer from space to Earth, as we know that we transfer from Earth to space. Some stuff you are going to do in space, you stay there. Some stuff you are going to do here on Earth and stay here. But there is this communication. It's been studied for over 40 years. Lots of areas are impacted by that. One of them is health and medicine. And I always like to try to bring this example of the pandemic, which the entire planet somehow became a spaceship, and we were all astronauts during this COVID pandemic. And some similarities, we had group tensions, isolation, confinements, because as astronauts were confined in their spacecrafts and space stations, we were also confined in our homes. So many stressors are in a space mission. So pre-flight stressors is, since you have this intense physical, mental, and emotional preparation, you have media attention, you have professional and personal expectations pre-flight. Then during the flight, in flight, we have physiological and anatomical changes, have work schedule, we have disruption of sleep cycles rhythm that we discussed before, unexpected risks, medical and health issues, then use telemedicine for that, communication problems, interpersonal tensions, separation from families, family and familiar references, confinement, and post-flight to have physical, mental, and social risks. So you can see that during the flight, you have, during a space mission, you have many aspects related to stress, but just taking the in-flight, communication problems, interpersonal and group tensions, separation from family and familiar reference, and confinement. These 4 items, very similar to what happened to us here on Earth during lockdowns and COVID. So what you learn from space, what the astronauts do, what they are trained to do, and what they should do during space mission to keep their well-being. Good communication with friends and relatives, it's very possible nowadays. They can even play games with them if they want. Seek medical or psychological help when needed. Keep a health routine, especially using prescribed medication. Daily habits, very important. Keep your personal hygiene, meals, hydration. Avoid alcohol consumption. It was one of the huge problem during COVID-19. Exercise at home. Take vitamin D because you're not being exposed to the sun. Find ways to entertain yourself. Keep your sleep pattern. Create objectives, very important every day to have objectives in your life. Access risks, and if you are related to that, try to create well-being methods like mindfulness, yoga, and spiritual things. What is very interesting that for astronauts after going to space and people with COVID, after this pandemic, we change and we change a lot as a society, as individuals, and a new set of values were basically created. So communication, family, friends, food, water, freedom, global actions, home, internet, peace of mind, safety, solidarity, and so on became very important, and other things became more unimportant, like cars, crowd, fame, fights, greed, individualism, material things, petrol, politics, and so on. So these astronauts go to this chain. When they come back to Earth, they come back with a very different way of perceiving our life, our planet. So there is this called the overview effect, space exploration and human evolution, which is created by Frank White, which is a space philosopher. It's this cosmic perspective of Earth that was given. The astronauts feel when they are in space, and we also felt by experiencing this situation with COVID and so on. And this is my last picture. We are just a pale blue dot in the vastness of the universe, and in contrast, it is everything to us. So this is something that completely changes our perception of our life in a society, the society in our planet, and our planet in the solar system, and our solar system in our galaxy. We are very tiny, and we are basically nothing in the universe. And it is very important for us to set our values in a better way, so we can really treat our planet with love and care. So thank you very much for your attention. I think that I spoke for 25 minutes, not 20 minutes. Sorry about that.
No worries. Thank you so much, Professor Thais Rosamano, for your presentation. I'm pretty sure every delegate and people that's going to see the recording will be really inspired by your talk. And you're 100% right. There's so many ways and speech fat can influence the mental health of patient, and you explained it perfectly. I believe there might be a question, but because of timing issue, because our next speaker is already here, Dr. Lava, I do apologize for the delay. They could potentially connect with you on LinkedIn and Twitter. And definitely everyone, if you're watching it, do follow the page of Professor Thais being Innova Space, in which you're the CEO, and there is very good resources which you do share, and I highly recommend everyone to follow the work of Professor Thais. And thank you so much. And without any further ado, into our next speaker. Once again, I do apologize for the delay, Dr. Live, and yeah, the floor is yours.
Great, thanks so much for inviting me. I'll be talking about our efforts both in our academic work as well as in our entrepreneurial work towards building a flavorful, nutritious, efficient, resilient, and sustainable food system. And I'm fairly new to the social prescribing pharmacy community, so hopefully what I'll talk about will be relevant, but I guess we'll see. I'm an associate professor in electrical and computer engineering at the University of Illinois in Urbana-Champaign in the United States, and also have further appointments in computer science, neuroscience, industrial engineering, digital agriculture, personalized nutrition, working with nutritionists and folks in our College of Agriculture has been very interesting for me. It's really helped me see kind of the broader food system beyond what I had been working on myself. I'm also quite connected to our Discovery Partners Institute, which is the new campus we're building in Chicago to promote technology transfer, commercialization, and so on, as well as workforce development. And it's been kind of an interesting journey there as well. I'm trying to take some of the technologies we've been developing in Urbana-Champaign and bring them up there as well. In addition to my academic work, I've also been involved in industry and startups. In 2010 to 2013, I was a research staff member at IBM Research in New York. And while I was there, I started and led the Chef Watson project, which was aiming to build computational creativity technologies, AI technologies, to develop novel and flavorful culinary recipes. And that was when I really got into food quite strongly. And that technology ended up being very successful. It led to kind of global interest, as well as partnerships with a lot of multinational food companies to help them develop new and interesting food products. I also spent a year on leave at Salesforce Research in Palo Alto, California, in Silicon Valley, where I was focusing on AI ethics and AI for good. And as part of my work at Salesforce, I was really looking into how to promote global well-being through AI technologies, and kind of developing some ethical frameworks for AI that borrow from ethical frameworks for biomedicine, So principles like beneficence, non-maleficence, respect for autonomy and justice. And so we've been working in that area as well. On the entrepreneurship side, I'm a chief scientist for NSERS, which is the AI plus wastewater treatment. And perhaps most relevant to this talk, I'm also founding chief science officer of Nutrios, which is a startup which is blockchain based, and we're trying to remake the food system. And we're currently largely in stealth mode, so it's just kind of a general. We are going to make it kind of a metaverse and Web3 kind of phrase. So we're still in the process of making things, but we are going to make it. My own scholarly training is in information theories, theoretical neuroscience, and the history and sociology of technology. And because of that, I think I have a different perspective than some. Kind of the idea of thinking about the limits of technologies, trying to think about how structure and function are intertwined, and how people are very much more complicated than technologies. But one of the kind of very interesting things with that background is that abstraction seems to be a very key aspect of engineering. And one of the great examples of this, quoting from William Cronin's book, Nature's Metropolis, about Chicago and the development of the Western United States, is that there was a very, so Chicago was kind of a center of trade, and the Midwestern hinterlands used to send grain there. But there was this kind of different, so there was kind of, each field was treated separately. Each shipment of wheat was traded with its own unique characteristics that distinguished it from all other lots of grain. But then there was this innovation that maybe one can categorize into white winter wheat or red winter wheat, spring wheat, and set standards to grade A quality. And then trade could happen with chits of paper rather than the specifics of each field and each shipment of grain. And that eventually led to the growth of Chicago as the center for world commodity trading, by this abstraction of wheat into this idea of just chit of paper that's white winter wheat of grade A. And this has been very powerful over the last 150 years, but it also has some deleterious effects. By disconnecting and disassociating people from the fields and from the specifics of their environment, it might reduce their well-being, actually. Right? And so there's these unanticipated consequences that we want to think about. And as we've been working on in this area now, we've been thinking about the agriculture system quite broadly, from going from the fields all the way to human health to wastewater treatment, in fact, a kind of food waste treatment. And it's kind of a very circular question, how to think about all of this, so that we can develop foods that are flavorful, that are sustainable, that are resilient, efficient, and nutritious. And as we think about this, artificial intelligence and blockchain can be very useful technologies to think about food as it goes through the full food pipeline, from production to processing to consumption, storage to treatment of waste, and so on. So, for example, one can build AI algorithms on top of blockchain-based supply chains to localize food contamination events, optimize to reduce food waste, increase system-level resilience. You can use creative AI to generate novel and flavorful recipes, perhaps using more plant-based proteins, and then also make the treatment of food and beverage waste more efficient. Okay. And as I was mentioning, the physical environment that was abstracted away in Chicago, in the grain elevators, is actually very important for health and well-being. Just to take an example from my own work, if you look at obesity rates in New York City at the level of neighborhoods, those neighborhoods that have many more opportunities for social interaction, that have more social capital venues, have much lower obesity rates, even after controlling for wealth and income and various other factors. And so it's suggestive that the built environment, the ability to build up social capital is actually very key to obesity and a variety of other lifestyle diseases. So one can think about kind of as a, from a public health perspective, that one wants to build parks and theaters and even restaurants, which maybe is counterintuitive, but places where people can interact socially. And as we've been thinking more and more about social capital, we've been seeing its impacts during the COVID pandemic in terms of driving various behavior like vaccination, distancing, masking, and so on. But perhaps even more so, we've been thinking through the neuroscience of well-being, and in particular, kind of the collective aspects of well-being. In fact, there can be a virtual cycle among the ability to solve problems, the ability to work together well in groups, and well-being that comes from working well in groups. So there can be kind of this virtual cycle that is enhanced by training in meditation or mindfulness training, things like that. So that can actually drive greater collective intelligence, that can drive greater problem solving, and then that can feed back into better individual well-being. To spend a little bit of time on the Nutrios project in the startup, what we're trying to do is really act as a way to connect social prescribers, people who have ideas on what nutrition might be useful, and consumers who have questions or desires in terms of their health and nutrition. And so we're building a blockchain-based system to be able to do these kinds of things. And it's been kind of an interesting journey so far, and we're hoping to come out of stealth pretty soon and be able to reveal all the technology we've been developing, but also the communities that we've been developing to help people lead healthier lives through their food choices. Just to give an example in my scholarly work, one example of what one might be able to do is to think about new food ingredients like algae. So algae is actually an incredible source of protein, and it's also super sustainable. It actually acts as a carbon sponge. And if one looks at its characteristics from an agricultural perspective, it requires much fewer emissions than meat, of course, but also rice, soy, and pea. Requires much less water, much less land as well. But the difficulty is people don't really like eating algae. It's not the most flavorful of things. And let me go back historically to the example of potatoes. So the potatoes were introduced from the New World into the Old World, along with a variety of other ingredients during the Columbian Exchange after 1500. And in fact, once it got to Europe, it took a while for things to spread. But once it did, the potato is estimated to have led to 1/4 of world population growth and urbanization in 1700, 1900, average adult height increase of 1/2 inch, and so on. I mean, huge impacts, much more than any technology you could think of. Like literally 1/4 of world population growth is attributed to the introduction of the potato in the Old World. And that's because potatoes provide more calories, vitamins, and nutrients per area of land than other staple crops like wheat and rice. But as I was saying, it took a while, right? Columbus came to America in 1492, but it's really only by 1700 or so that the potato spread through Europe and Asia and Africa. And the reason is as follows. So if you look at Diderot's encyclopedia from the mid-1700s, no matter what it was said is, no matter how you prepare it, the root is tasteless and starchy. Only when Madame Marigeau published this La Cuisine Républicaine, it's a 1795 cookbook with several flavorful potato recipes, and then Parmentier also focused efforts on the novelty of potatoes, did the potato really take off. In fact, my grandmother, she grew up in India, in North India, and when she was a kid in the 1930s, in fact, potatoes were not as popular, were not very popular at all. Which is surprising given how prevalent potatoes are to Indian cuisine now, right? So just less than 100 years ago, when my grandmother was a child, the potato still wasn't popular in North India. But as we can figure out, the food problem is a flavor problem. Right? We've been making the stuff people should eat, like fruits and vegetables, whole grains, less delicious. Meanwhile, we've been making food people shouldn't eat, like chips and soft drinks and crackers, taste even more exciting. And the result is exactly what you'd expect. And so what we've been doing over the years is to use computational creativity, AI technologies, to help scientists develop new formulations and recipes using nutritious and sustainable ingredients of algae, and that capture the consumer's imagination to develop these new ideas. So just like this cookbook, maybe we can develop our cookbooks like the cognitive cooking with Chef Watson cookbook that we had for these even more sustainable and resilient and nutritious ingredients like algae. We can even hide flavors using a technique called food steganography. And as I said, we can build these large-scale AI technologies that draw on the neuroscience of flavor perception, the chemistry of flavor, the hedonic psychophysics of flavor perception, ideas from flavor networks, and the practice of culinary practice in a variety of cuisines, the idea of novelty as a draw for human attention, and so on. Right? So what we believe is that computational creativity, food steganography, perhaps through these blockchain-based systems and connecting the metaverse back to the real world and drive wide-scale behavioral change in food systems, and perhaps support this idea of social prescribing. Right, so I did have more slides on other uses of blockchain in the food system, like in agriculture, to do virtual land aggregation, to understand food contamination events, and to further understand the food trade dynamics. But let me stop there, and I'm happy to take questions if there's any.
Thank you so much, Dr. Love, for your presentation. It was very insightful, especially that historically, when we talk about pharmacy and pharmacy student, we tend to be so focused on the human body and also on the medicine part, but we don't really cover in much detail about the source of the food that we take, and having is like a solution that you provide where I can see in the future, whereby there could be some kind of AI for good, which could provide, like you said, personalized food recipe for people at a low cost. For example, taking advantage of algae. Going back to Professor Mahmoud's speech, where he talked about the poor, the demographic, they're more likely to eat unhealthy food because it's cheaper than healthy food. And what he covered was really kind of give a bigger picture than, because many people tend to have a tunnel vision, right? And the reason why I was so passionate about having you today is to kind of bring your perspective on the macro level, and you're able to demonstrate perfectly. So thank you so much. If anyone has any question, feel free to write in a text chat booth or in the Q&A section. So let me check. So far, no question observed yet. But so in your opinion, what would be the best way for people to connect with you in case if they got more further question about your work, or potentially having some of the pharmacy student doing some kind of research project based on what you do or work on? Because I strongly believe food for health is going to become a big part of the health industry, especially as we shift from a reactive approach to a proactive one, right? Prevention of illness.
Yep. Yeah, so anyone should feel free to email me, varshney@illinois.edu, or you can follow me on Twitter, or yeah, I mean, yeah, those are good ways of getting connected, and happy to follow up with anyone who's interested in this direction.
Thank you so much, Dr. Lav. So yeah, anyone feel free to message me, and I will provide you the Twitter handle of Dr. Lav. And so once again, thank you so much.
Yeah, my name is fairly unusual. It's easy to find. So I'm one of the only Lav Varshneys in the world. So pretty straightforward. All right, thanks so much.
Thank you so much, Dr. Lav. Have a nice rest of the day in America. Thank you. Bye. So now we have our next speaker being Katie Connolly. So remind me, Katie, do you want me to share my screen? And so as you talk, I shift the slide. Is that correct?
No, it's all right. I'll do it myself. Is that
Okay, sure.
Oh, hang on. I have to shut something down.
No worries.
Hang on. Stop share. If you share your screen for me, that'll make life much easier. Thank you.
Yeah, I'll do it right now. share screen, desktop
I
one.
just haven't got very good lighting in this room right now, so can you see me okay?
Yeah, I can see you okay, yes. So
I'd just like to say that the speakers all evening were amazing. I really feel very privileged to be part of this. So nice to listen to so many viewpoints and learn so much as well myself. Right. So the screen's on you right now, Arun. Is that the way it's supposed to be?
So oh, it's on me. It's not showing it's not showing the slide.
No, it's showing the slide, but it's not showing me.
Oh, I can see you. I can see.
Okay, no problem. All right, so hi everyone, for everybody who's managed to stay. My name is Kathy Connolly and I am the Chief Executive of an organisation called Care Merseyside. We are a social prescribing charity, a GP-led social prescribing charity, the first of its kind, and how it was funded, if I'm fully aware, in the whole of the UK. That is because